What's going on, world? What's up? Hey, yo, nurses. I love each and every one of y'all. Y'all already know what today is. Today is Wednesday, the 8th of November. Yeah, we out here. We doing stuff. 7-day NCLEX course. Y'all already know it's in full swing. It's in full swing. Hey, I got part of the review up there. Got part of the review up there, part 1 and part 2. I try to keep each one of my NCLEX videos under 30 minutes because who the hell wants to sit there for hours to try to get content or, understand NCLEX style questions or anything like that. So if you are new here, I want to know who you are, where you're from, where you were at in your nursing journey. Not even gonna lie, I put this filter all the way up because this face is looking smooth as butter. You feeling me? So, hey, like I said, I want to know who you are, where you're from, where you're at in your nursing journey. Today is Wednesday. We're going to go over NCLEX questions. As soon as I get 100 people inside of this live, we are going to get it on and popping. I got these questions off nurselabs.com. Yep. Nurselabs.com. It is a website where they have free questions. I don't know what the questions are. Sometimes I just go through them just to make sure I have them on here for y'all. And then we just go through them together. We read it together. We kind of go through the answers together, as well as I reiterate a bunch of good things that you guys need to know. Miss Independent, you're from Canada. Shout out to Canada. Shout out to you. Hey, if you guys are new here, welcome. I want to know who you are, where you're from, where you're at in your nursing journey. Also, if you're not a nurse, I want to know what you do. If you don't do anything in the medical field, I also want to know what you do. We've had some folks that came in here. I've had some residents. I've had some PAs. I've had students. I've had all different types of folks that came up in here. So like I said, y'all go ahead and y'all drop that. But make sure that you like, you share, and that you follow. OK, don't be greedy your whole life. The likes help the live get out to people. Right. The follows help me in order to get out to people, and the shares help you send that information to other people who may need it. You never know who's going to need it. I'm a PSW. What's a PSW? Pre-nursing student. Okay. Okay, I see you, pre-nursing student out there. All right. What else? What else we got going on? Yeah, make sure you guys smash that like button. Hey, there's people that have reached out to me or that have been in this live from afar. Australia, Nepal. I still can't get over the fact that somebody that lives near Mount Everest, which I'm pretty sure you guys are just like, oh, whatever, it's a mountain. But, from somebody that's all the way here in the States, who's never planning on going to Mount Everest. It's nice seeing people see that the reach gets all the way there. So, hey, if you guys are just joining, we're going to go over NCLEX questions, but as soon as we get 100 folks up in here, I'm going to turn this thing around so you guys don't have to look at this hideous face and this messed up shirt, hey, but shout out to The Rock, you know what I mean? But who you are, where you're from, where you're at in your nursing journey, make sure you kill that like button, not literally, but make sure you handle it, right? Share and follow, all right? It says, bro, I took the psych-hesi test and I hated it. I bet you did. I bet you did. What's a personal support worker? Okay. All right. Cool. Dolly, you're from San Antonio. Okay, cool. Shout out to San Antonio because, that's where I reside, Shout out to San Antonio. I love this. I love this big little city. In my opinion, it's big, but it's little. We kind of spread out all over the place. So a little bit about me. Been in the Navy for 16 years. For those that don't know, failed my NCLEX 3 times, y'all. Failed it 3 times. Been a nurse for 3.5 years. Worked in ICU. Worked in OR. Worked in the PACU. So I got a little bit of experience. You know what I'm saying? A little something. It says we'll start nursing school next year. Shout out to you, Eliza. You're from the NY. Shout out to the NY. What part of New York you from? Brooklyn, the Bronx. What we talking about? Tree said DFW, medical assistant, cardio, currently taking prereq. Shout out to you, Tree. Shout out to you. Hey, so we got 93 folks in here. How did I like the OR? I like the OR. OR is cool. Hey, we got 90 folks up in here. Hey, we got to get some more folks up in here so we can get these questions. Long Island, is that even part? No, that's Staten Island. They don't consider themselves part of it. So, but trying to get some more folks up in here, y'all. So, like I said, I want to know who you are, where you're from, where you're at in your nursing journey. You're Carolina. You're from Jersey. Okay, shout out to Jersey. I don't know. Every time I think of that South Park episode, every time I think of Jersey. So, but all right, y'all. I think I've waited long enough. We'll see if some more folks come up here. You're from Michigan, okay? Preparing for NCLEX, Angelica. Okay, shout out to you. Graduate in December, my guy. Keep it up. Look, hey, this is what I do. I love doing this. I look forward to doing this almost. If I could do it every day, I would. But we got things to do around here. So, hey, at one point we had over 100 people up in here, but, they're lost if they don't want to stay and hang out with me. So, hey, Lena said, am I late? No, Lena, we just started. I just turned the camera around. So, hey, real quick, couple of things before we get started. Hey, so I'll do these breaks every 5 to 10 questions. In reality, I'm going to do them every 5. If you don't like it, sorry. Participate. I'm kind of funny sometimes, but whatever. I'm a comedian. Make sure you like, make sure you share, make sure you follow. Don't be selfish your whole life, okay? Don't come into my chat. If you troll my chat, I'm going to ban that ass. It says it right there. I'm going to ban that ass. So try me if you want to. Don't be coming in here selling me your nudes because I can get them for free. I got these questions off nurselabs.com. You guys can go over there and check that out for yourself. 7-day NCLEX course, which is mine. It's $48 right now, you guys. $48. And once you get it forever. All right. And if you need one-on-one tutoring for NCLEX, you guys can check out that link in my bio as well. And then afterwards, we'll do a quick little Ask Me Anything. See how that goes. All right. Here we go. All right, here we go. Question number 1. During a routine checkup, nurse Mary Ann assesses a male client with acquired immunodeficiency syndrome or AIDS for signs and symptoms of cancer. What is the most common AIDS-related cancer? Is it squamous cell carcinoma, multiple myeloma, leukemia, or Kaposi sarcoma? What are we thinking? Oh, I got to put you guys on a timer. So I'm going to give y'all 25 seconds. Hey, if you guys are new here, welcome. We're doing NCLEX questions. I got them off nurselabs.com. Make sure you guys smash that like button, you share, and you follow. Because I know that you're not greedy, right? You're not greedy? I know that's right. All right, I want to know who you are, where you're Carposi. I want to know who you are, where you're from, where you're at in your nursing journey. It says you have a nice voice. You need to start doing voiceover business. Ma'am, trust and believe me, I have looked into that, and I have done some voiceover stuff before. So I appreciate that. 146 folks up in here. Appreciate everybody rocking with me. I'll give you guys another 10 seconds. 1 year left. I know that's right, Steph. I see you out there. All right, y'all. Here we go. Here's our answer. Here is our answer in 3, 2. And the answer, of course, is Kaposi. Kaposi sarcoma is the most common cancer associated with AIDS. That is a part of the physiological adaptation section. That is the third largest section on the NCLEX exam. It doesn't matter which exam it is. If it's the PN or the RN, still the third largest section from 14 to 17%. Okay. Hey, sorry, joined late. I'm here. What's up, Manasa? Manasa's my moderator, y'all. She's actually one of the best people that I know. So welcome, Manasa. She's been a nurse for a little over a year, master's degree, working med-surg, loving her life. So shout out to everybody that's up in here. Here we go for question number 2. Lauren says, I'm a PA student, but always using nurses. Hey, I love that, Lauren. Hey, always lean on your nurses, right? Because your nurses will save you. And if you got any doctors in here, they'll save you too. Trust and believe me. I may have saved a few myself. Question number 2. Ricardo is scheduled for a prostatectomy, and the anesthesiologist plans to use a spinal block during surgery. In the operating room, the nurse positions the client according to the anesthesiologist's instruction. Why does the client require special positioning for this type of anesthesia? Prevents confusion, seizures, cerebral fluid leakage, or cardiac arrhythmias. Carposi is on my medical school exam tomorrow. Shout out to you. Is it Sierra? Shout out to you. Hey, so you better get that question right then if it pops up, huh? Hey, shout out to everybody. Hey, we got 140 people up in here. Make sure you guys keep smashing that like button. You guys share and you guys follow. Hey, I need to get to 20,000 likes, y'all. I need 20,000 likes so TikTok can, I don't know what TikTok's going to give me, but you already know the deal. So 10 seconds, y'all. 10 seconds. See, I'm in high school. I'm a high school senior. I hope I got this right. Gina, that's okay if you don't get it right because that's what we do this for. Is so you can learn it and then get it right the next time you see it. You know what I'm saying? That's how we do around here. All right, y'all. Here we go. Here's our answer. Here is our answer in 3, 2. And the answer is C, to prevent cerebral spinal fluid leakage. The client receiving a subarachnoid block requires special positioning to prevent CSF leakage and headache, and to ensure proper anesthetic distribution, right? That is part of the reduction of risk potential. We on a roll, y'all. I know that's right, Steph. Let them know. That's part of reduction of risk potential. If I remember right, I'm going off the top of my head. It's either 6 or 9 to 12% on the NCLEX exam, y'all. Appreciate all the follows. Your girl, is it Kel? It's Fry. Hey, I appreciate out Carolina for the share. OEK, appreciate you. Here we go. Question number 3. A male client had a nephrectomy 2 days ago and is now complaining of abdominal pressure and nausea. The first nursing action should be what? Remember the word first, systematic, right? So I'm going to go step 1, step 2, step 3, step 4. So what is the first step? Is it auscultate bowel sounds, palpate the abdomen, change the patient's position, or insert a rectal tube, right? What do we got? Everybody's screaming A. About to finish up third semester. Shout out to you, Fry. Hey, it's almost, before you know it, you're going to be walking across that stage. And that's what we want. Shout out to all 130 of y'all. Hey, we're doing NCLEX questions. If you guys are new here, I want to know who you are, where you're from, where you're at in your nursing journey. All right. Got these questions off nurseslabs.com. All right. Y'all keep smashing that like button. Make sure you guys keep sharing and keep following because you care about other people and you want their knowledge to expand. You know what I'm saying? Got to study for them, man. See y'all tomorrow. All right, BB, go handle it. All right, y'all. Here we go. Check sound. Okay, I hear you, Thomas. All right, here we go. Here's our answer. Here is our answer in 3, 2. And the answer is A. Auscultate vowel sounds, right? So we need to, they're complaining about something, so we need to assess before we implement, right? They're giving me, a subjective statement, so I need to be able to get objective data, if that makes sense, okay? An abdominal distension is accompanied by nausea, and the nurse must first auscultate bowel sounds. If bowel sounds are absent, the nurse should suspect gastric or small intestinal dilation, and these findings must be reported to the physician. Physiological adaptation, third largest section on the NCLEX, all right? Third largest section. Hey, so one quick thing, there was somebody that I coached over the last month, and she passed her license today. She passed her LVN today. She probably won't show up in here to tell nobody that, but I'm going to tell her that right now. So shout out to you, Helen. Congratulations. She's an LVN now. Welcome to the shit show. Greatest shit show on earth. There we go. Don't need to do NCLEX, but this is making my medical hyper. Okay. Is that Bex? Hey, I got you, Bex. I got you. Here we go. Question number 4. Is it Wilfredo? Wilfredo, who, nice name. With a recent history of rectal bleeding is being prepared for a colonoscopy. How should the nurse position the client for this test initially? Right? So initially, meaning at the beginning or first, right? Lying on the right side with the legs straight, lying on the left side with the knees bent, prone with the torso elevated, or bent over with the hands touching the floor. I don't know why I laughed at that. I'm sorry. Bend over to the front, touch your toes. All right, I'm done. No more of that nonsense. Shout out to all 130 of y'all in here and listen to me run my mouth. You said it's Abby, you say it's definitely D. Ma'am, are we on the same page? I was rapping that song too. All right, cool. Hey, at least I'm not the only one. Hey, at least I'm not the only one. 10 seconds, y'all. 10 seconds. Hey, y'all wild out here. Y'all need to stop it. All of y'all. All right, here we go. Hey, that's why I love coming on here. Y'all wild out here. Here we go. Here's our answer in 3, 2. And the answer is definitely not D, Abby. Okay. Lying on the left side with the knees bent. For a colonoscopy, the nurse initially should position the client on the left side with the knees bent. That is part of reduction of risk potential. Sorry, I was trying to read what y'all was saying. Get low. You already know what it is. I think it was wrong. It was definitely D. Ma'am, stop it. But yeah, reduction of risk potential, 6 to 6 or 9 to 12% on the NCLEX. Okay, my colonoscopy, I was on my right side. Hey, so remember, this is all based off of the book. So they may turn you on your left side. They may turn you on your right side. Get low. All right, y'all. Hey, here we go. Question number 5. A male client with inflammatory bowel disease undergoes an ileostomy. On the first day after surgery, Nurse Oliver notes that the client's stoma appears dusky. Keyword, dusky. How should the nurse interpret this finding? Is it A, blood supply to the stoma has been interrupted? This is a normal finding the first day after surgery. The ostomy bag should be adjusted, or intestinal obstruction has occurred. What are we thinking? I'll give y'all 20 seconds. Hey, if you guys are new here, we're doing NCLEX questions. I got them off nurseslabs.com, so you guys can go over there and check those out for yourself. Also, make sure you guys smash that like button. Make sure you guys share. Make sure you guys follow because, first of all, follow me because I'm fucking awesome. All right, so let's just go ahead and get that out the way right now because we was just jamming. If you was just jamming with me, I'm going to need for y'all to smash that like button. I'm going to need for y'all to follow me. All right, stop playing games. All right, so here we go. And also make sure you guys share, follow, like, do all that stuff. So here we go, y'all. Here we go. Here is our answer. Here's our answer in 3, 2. And the answer is A. Blood supply to the stoma has been interrupted. An ileostomy stoma forms as the ileum is brought through the abdominal wall to the surface skin, creating an artificial opening for waste elimination. The stoma should appear cherry red, indicating adequate arterial perfusion. A dusky stoma suggests decreased perfusion, which may result from interruption of the stoma's blood supply and may lead to tissue damage or necrosis. So if it's gray and nasty, you better start calling some folks. You better start, hey, this ain't looking too good, doc. You know what I'm saying? You know, little Yana, you know, a little something, girl. That's what I'm talking about. Everybody's some smarty pants. Who gave me a heart up in here? Who gave me a heart? Is it T Lynn? I appreciate you, T Lynn. Appreciate you. Hey, reduction of risk potential. Okay. Hey, real quick, commercial break. We're doing NCLEX questions. Make sure you guys participate. Give me all them likes. Give me all them shares. Don't be selfish your whole life. You come into my chat and you troll me. I'm going to troll you. Then I'm going to give you a 600, aka I'm going to ban that ass. So please don't test me, because you will lose. Anyways, nurselabs.com is where I got these questions from. You guys can go over there and check that out for yourself. Also, 7-day NCLEX course is in its pre-launch phase. It's going away on Black Friday. I'm telling you right now. So go over there and get it for $48, y'all. $48. Link is in my bio. Also, if you want help one-on-one with the NCLEX, that link is also in my bio. And look, I just helped somebody coach, and she passed her NCLEX today. I'm just letting y'all know she passed her NCLEX today at 85 questions. She felt the most confident that she's ever felt. And look, she's about to go out there and, you know, and do some good things, you know, working in the pediatric realm, you know. So just letting y'all know, y'all go over there and y'all check that out. Hi, Kevin. How did you start in the healthcare field? I joined the Navy. That's how it happened. I got swindled into becoming medical, and I could talk about that later. But anyways, here we go. Question number 6. Anthony suffers burns on the legs. Which nursing intervention helps prevent contractures? Is it applying knee splints, elevating the foot of the bed, hyperextending the client's palm, or performing shoulder range of motion exercises? What are we thinking? What are we thinking? Shout out to everybody that's in here. Hey, if I'm not reading your comments, I'm trying to read these questions. So I'm trying to read these questions for y'all. What's wrong? What happened? Somebody said something that was wrong. We got D's, we got some B's, we got some A's. Throw some D's on it. I didn't see it. Say shoulder. Look, hey, who knows what RTFQ means? Hey, if you've come to my lives a lot, you know what RTFQ means. You better read that question. Read the expletive word question. Make sure y'all do it. All right. I can't say it because sometimes I said the F word and somebody's like, man, my babies are around. So, oopsie. Read the ducking. Yeah, Lauren, whatever. Just bought a Cadillac. Stop it, Casey. Don't do that. Just throw some D's on it. Y'all wild out here. Critical care for a semester, so I'm not sure, but hey, that's okay. I'd rather you guess than not do anything at all. All right, here we go. I'm not even out of high school, and I'm guessing. That's okay. You can guess. I want you to guess because you're gonna find out what the answer is in 3, 2, and the answer is A. Applying knee splints. Applying knee splints prevents leg contractures by holding the joints in a position of function. Right? Boom. That's what I'm talking about, Steph. That's what I'm talking about. So is there something wrong with the live? Why? What's going on? What Gemini? What's wrong? What hey, is there an issue going on? Y'all let me know down in the chat. Hey, physiological adaptation. That is the third largest section. What's going on with the chat? What's going on? No issue? All right, Ryan. Cool. Ryan done already told me. No issue. Here we go, y'all. Hey, physiological adaptation. Third largest section on the NCLEX. All right, here we go. Question number 7. Nurse Ron is assessing a client admitted with second and third degree burns of the face, arms, and chest. Which finding indicates a potential problem? Is it the partial pressure of arterial oxygen valued at 80 millimeters of mercury, or is it a urine output of 20 an hour? Is it white pulmonary secretions, or a rectal temp of 100.6? Okay, y'all can. Is your name anticoagulant? Stop it. Stop. I'm not gonna lie to you. That's funny. Hey, so what are we thinking? I passed my NCLEX RN because of your live. Stop it, Aaron. Did you? Hey, everybody, stop answering right now. And I need for y'all to give Aaron all the love in the world right now. Give it to her. Congratulations, Aaron. Congratulations to you. Welcome to the shit show. Welcome to the greatest shit show on earth of being a nurse. I know that you worked real hard for it, and I've seen you come into my lives a lot, and I've seen you participate. So I'm super happy for you, super proud of you. I'm glad that you went out there and you did the damn thing. Hey, and that goes for anybody. Y'all come up into my chat and you guys participate and y'all tell us that you passed your NCLEX. I'm going to give you all the love in the world. I promise you. So congratulations to Aaron. Welcome to being a nurse. Now it's time for you to go out there and do some great things. All right. So Let's say, what are we thinking? What are we thinking? We got some B's, some D's. LP in here, waiting to start my iron program, looking to encourage. All right, cool, got you. All right, here we go, y'all. Here's our answer in 3, 2. And the answer is B, urine output of 20 mLs. A urine output of less than 40 mLs an hour in a client with burns indicates a fluid volume deficit, right? Hey, so think about this. When we have somebody who has burns, what is our biggest issue? What is our biggest issue? All right, a physiological adaptation, third largest section on the NCLEX, all right? So we got to think about dehydration. Yes, dehydration, right? Fluid loss. So guess what? If I have a lower urine output, I'm telling you right now, it has to do with the kidneys, because I'm telling you right now, once the kidneys go, it's like your alternator going out in your car. The rest of the car is going to fucking fall apart. Okay, so dehydrate. There you go. Kidneys are going to shut down first. That's what I'm trying to tell you. Man, I love y'all. Y'all are fucking great out here. That's what I'm talking about. Hey, on to question 8. Mr. Mendoza, who has suffered a cerebral vascular accident, is too weak to move on his own. To help the client avoid pressure ulcers, Nurse Celia should what? Turn him frequently, perform passive range of motion exercises, reduce the client's fluid intake, or encourage the client to use a footboard. What are we looking at? What are we thinking? Shout out to all 400 of y'all that are in here rocking with me. I want to know who you are, where you're from, and where you're at in your nursing journey. Also, make sure you guys smash that like button. Make sure you guys share, and make sure you guys follow. Mostly it's because I tell you those 3 things is because you're not selfish. You're not selfish, are you? Yeah, that's right. I know you guys aren't. You guys are awesome. You guys are great. Everybody's screaming A at me, by the way. So that's too easy. Steph, need help. Who said I need help and I failed 3 times? Hey, if you need help or you're looking for help, go check out my my link in my bio where it talks about one-on-one NCLEX tutoring. Go check that out, okay? All right. Is your name Annika from NY? First of all, anybody's name that is Annika or Monica, if y'all have seen Fast and the Furious, the first one, you already know what I'm going to say. You already know what I'm going to say. Texas Accelerated BSN program. Shout out to you. All right, y'all. Here we go. Here's our answer. Here is our answer in 3, 2. And the answer is A. We're going to turn him frequently, right? Because we want to take them pressures off those bony prominences. The most important intervention to prevent pressure ulcers is frequent position changes, which relieve pressure of the skin and the underlying tissues. If pressure isn't relieved, capillaries become occluded, reducing circulation and oxygenation of the tissues, and resulting in cell death and ulcer formation. Wow, no idea why I said it like a speak and spell. But there you go. Basic care and comfort. 6 to 12% on the NCLEX, okay? 6 to 12%. How often do you turn them? Doesn't matter. Doesn't matter. That's not what they asked. However, it could be every hour, it could be every 2 hours, it could be every 4 hours. It all just depends. But that's not the question that they asked you. That's not the question that they asked you. Every 2 hours, every 2 hours, every 4 hours. It all just depends on whatever the policy is. But on NCLEX, it's going to be every 2. All right. So those are one of those things that you learn. If you get a question asking how many times you have to turn a patient on NCLEX, I really want you to think about that, because NCLEX is all about analysis, application with those 2 types of questions. Those are the questions that you want to get, allowing you to use critical thinking and clinical judgment. Okay. All right, here we go. Question number 9. Nurse Maria plans to administer dexamethasone cream for a female client who has dermatitis over the anterior chest. How should the nurse apply this topical agent? Circular motion to enhance absorption, upward motion to increase blood supply to the affected area, and long, even outward and downward strokes in the direction of hair growth, or in a long, even outward and upward strokes in the direction opposite of hair growth. What are we thinking? What are we thinking? Hey, if you guys are new here, we are doing NCLEX questions. I got them off nurseslabs.com. You guys can go over there and check that out for yourself. They are free questions. Free questions. And something else I want to tell you guys is that your new generation NCLEX, when you guys go and take it, 60 to 70% of it are multiple choice and select all that apply. The last 40% are the different type of questions that they ask you. All it is just how the question is delivered to you. So case studies, highlights, drop in or fill in the blanks, matrix, the bow tie, stuff like that. Okay. All right, y'all. Here we go. Here's our answer, y'all. Here is our answer in 3, 2. And the answer is C, in long, even outward and downward strokes in the direction of hair growth. When applying a topical agent, the nurse should begin at the midline and use long, even outward and downward strokes in the direction of hair growth. This application pattern reduces the risk of follicle irritation and skin inflammation. That is part of physiological. Oh my God. That is part of pharmacological and parenteral therapies, which is the second largest section on NCLEX at 15 to 18%. Second largest section. I don't have hair on my chest. Well, damn, Lynn. Okay. Well, you know what? I need help. Help someone. I'm uncomfortable. All right, here we go. Question number 10. Nurse Kate is aware that one of the following classes of medication protects the ischemic myocardium by blocking oh my God. I'm trying to see what y'all are saying, and y'all are saying a lot. What is it? Oh my God, it's the catecholamines. Oh my God. And sympathetic nervous stimulation is what? Is it the beta blockers, calcium channel blockers, narcotics, or nitrates? I'm over here. Look, I'm not a 10-year-old getting ready for a spelling bee. Because look, I don't be saying these words right. And if you want to judge me, you can go on the internet and complain. Hey, here we go. Hey, if you guys are new here, we're doing NCLEX questions. Got them off nurselabs.com. A shout out to my homie, Manasa, for helping me get these questions together. If it wasn't for her, we wouldn't have got these questions tonight. So shout out to her. She's also my moderator, making shit happen too. So I appreciate you. Appreciate you, girl. Appreciate you. All right, y'all. Here we go. Here is our answer. Y'all are screaming A and B at me. Well, we about to find out what the answer is in 3, 2. Thank you for the rose, D. Appreciate you. And the answer is A, beta blockers. Beta blockers work by blocking beta receptors in the myocardium, reducing the response to catecholamines and sympathetic nerve stimulation. They protect the myocardium, helping to reduce the risk of another infarction, but decrease myocardial oxygen demand. That is also part of pharmacological and parenteral therapies. Hey, when you guys are studying, you guys need to read these rationales. There are 3 things that you need to do. You need content, you need questions and answers, and you need to read your rationales. Those are the 3 things that you need to do in order for you to understand. All right, good to go. Here we go. Everybody got that understood? Go on to the next question. Oh, real quick. Commercial break. Hey, make sure you guys participate. All right. Participation is the key. That is how we get stuff done. All right. My bad. I'm sorry. Hey, share, and follow. Don't be selfish your whole life. Don't troll my chat. If you troll my chat, I'm going to ban you. I got these questions off nurselabs.com. Make sure you guys should go check out the 7-day NCLEX course. That link is in my bio for $48. On Black Friday, it's going away. I'm telling you right now. And if you guys want one-on-one tutoring, you guys can go over there and check out the 7-day. Check out that link in my bio. And we're going to do an Ask Me Anything after this. So you guys can come over there and check that out as well. Here we go. Question number 11. Hold on. What did somebody say? It says, first graduating class in Concord, Jacksonville, Florida, a.k.a. taught myself. Second NCLEX, test later, high risk OB. Okay, LJ. All right now. All right, here we go. Question number 11. A male client has jugular distension. In what position should the nurse place the head of the bed to obtain the most accurate reading of jugular vein distension? High Fowler's, raised 10 degrees, raised 30 degrees, or supine position? What are we thinking? Hey, and it's okay if you guess, y'all. It's okay if you guess. Is it Karina? Thank you for the follow. L, thank you for the follow. Appreciate you. All right. Hey, if you guys are new here, make sure you guys keep smashing that like button. Make sure you guys share. Make sure you guys follow. Also, I got these questions off nurselabs.com. You guys can go over there and check that out for yourself. But I want to know who you are, where you're from, and where you are at in your nursing journey. And if you're not a nurse, I want to know what you do. All right. Shout out to all my patient care techs, my CNAs, my occupational therapists, patient care tech or patient physical therapists, X-ray. I love all y'all. EMTs, paramedics, y'all Gucci out here. I love every single one of y'all. PA students, shout out to you. All right, y'all. Graduating through 3 weeks, Val. Ultrasound tech. Okay, girl. Medical assistant. Y'all wild out here. Here we go, y'all. Here's our answer in 3, 2. And the answer is, who said A is easy money? The lies you tell. Anyway, so the answer was C. Jugular vein pressure is measured with a centimeter ruler to obtain the vertical distance between the sternal angle and the point of the highest pulsation, with the head of the bed inclined between 15 to 30 degrees. You don't like pets? What you mean? I got a dog. What you mean? Anyways, hey, that's part of reduction of risk potential, okay? Anywhere from 6 to 9 to 12% of the NCLEX. Smaller section, but definitely will get you over the top if that's the last part that you need, okay? So here we go. And if somebody says, why not A? In high Fowler's position, the vein would be barely, discernible above the clavicle. There, that's your answer. That's why it's so important. You don't like patient. I love patient care techs. I said that twice, actually. So look, I'm trying to tell you, hey, I'm a corpsman in the Navy, and I'm telling you, like, we learn a lot from, well, the nurses learned a lot from us, but you already know, y'all know what I mean. So, but my patient care techs when I worked in the ICU, loved every fucking one of them. They were great. Here we go. Question number 12. The nurse is aware that one of the following classes of medications maximize cardiac performance in clients with heart failure by increasing ventricular contractility. Is it beta blockers, calcium channel blockers, diuretics, or inotropic agents? A, easy money, beta receptors. Okay. I don't know. Somebody else said that too. Cardio is not my strong suit. Hey, so if you know cardio is not your strong suit, just spend an extra 30 minutes to an hour, looking over content for it. Doesn't have to be anything. No one's telling you to fucking dive into it and be there for hours and days, but give yourself a little bit extra time throughout the day to learn it. All right. If you guys are new here, make sure you guys smash that like button. Make sure you guys share. Make sure you guys follow. All right. That's the trifecta that TikTok wants. And that's what I need because, that's what I need out here. I'm so smart. I know that's right. You don't know? That's okay. I'd rather you guess. All right, y'all. Here we go. Here's our answer. Do I do a review for the PNs? Absolutely. In 3, 2. And the answer is inotropic agents. Inotropic agents are administered to increase the force of the heart's contraction, thereby increasing ventricular contractility and ultimately increasing cardiac output. Give it for me. Is it Rylan? Shout out to you, Rylan, for getting that answer. You're interested? You can go check that link out in my bio. It'll say 7-day NCLEX course. So the 7-day NCLEX course, that's in its pre-launch phase right now. It is both for RNs and LPNs. So you guys can go over there and check that out, okay? All right, here we go. Question number 13. A male client has a reduced serum high density, the lipoprotein level, and an elevated low density lipoprotein level. Which of the following dietary modifications is not, keyword, is not appropriate for this client? Fiber intake of 25 to 30 grams daily, less than 30% of calories from fat, cholesterol intake of less than 300 milligrams daily, or less than 10% of calories from saturated fats. What are we thinking? Hey, shout out to all 400 of y'all in here listening to me run my mouth. I love every single one of y'all. Make sure you guys like, share, and follow. Got these questions off nurselabs.com. I talk so much that I should be a fucking auctioneer. Also, hey, if you guys are new here, I want to know who you are, where you're from, and where you are at in your nursing journey. Where you are at in your nursing journey. Jason and Erica, appreciate the follow. Anissa says C. One of my mentors, her name is Anissa, but she has 2 N's and 2 S's. All right, who is that? Maddie, graduating in December. Hey, shout out to everybody that's about to graduate. Nurse of 42 years. Okay, Miss Steph, I see you out there. Hey, I'm 36, so I don't know how you feel about that. All right, here we go. Here's our answer. In 3, 2. And the answer is B. Less than 30% of calories from fat. The client with low serum HDLs and high serum LDLs should get less than 30% of daily calories from fat. That is physiological adaptation. Fry, why are you laughing? Why are you laughing? Is it because of what I said? My bad. Rylan, are you telling me what happened? I don't know what happened. Are you rushing me, Rylan? Because you already know what I'm finna do. Oh, let's fucking go. That's what I'm talking about, Rylan. That's what I'm talking about. All right, here we go. Question number 14. You got it wrong. It's all good. It's all good, Fry. It's all Gucci out here, baby. That's how we do. A 37-year-old male was admitted to the coronary artery unit, or the CCU, 2 days ago with an acute myocardial infarction. Which of the following actions would breach the client's confidentiality? The CCU nurse gives a verbal order to the nurse on the telemetry unit before transferring the client to that unit. The CCU nurse notifies the on-call physician about a change in the client's condition. The emergency department calls up the latest, the ECG results to check the client's progress. At the client's request, the CCU nurse updates the client's wife on his condition. What are we thinking? Shout out to all 300 and a lot of y'all. Appreciate y'all. Make sure you guys keep smashing that like button. Make sure you guys share. Make sure you guys follow. All right. Got these questions off nurseslabs.com. If you guys want to review, 7-day NCLEX course, $48. If you want coaching from me one-on-one, you guys can check that link out. It is also in my bio. I actually had one of my students today get past her NCLEX, so you guys are going to be seeing that testimony come out here real soon. All right. See, she out of line. All right. It was an ED nurse needs to chill. Look, I'm trying to tell you, hey, the ED, they be wild out here. I'm trying to tell you, I want to go down there and throw hands. Y'all can go throw hands with them. All right, here we go. Here's our answer, y'all. Here is our answer in 3, 2, and the answer is C. I'm just remembering what Ryland said. That's hilarious. But the emergency department nurse calls up to the latest ECG results to check the patient's progress. The emergency department nurse is no longer directly involved with the client's care and thus has no legal right to information about his present condition. That is a management of care. That is the largest section on the NCLEX at anywhere from 18 to 21%. That is the largest section. I'm throwing these answers. You're like, I'm throwing these answers. Let me take that in. Hey, Ryland, go ahead, take that NCLEX and come back. Tell me how you do, girl. You already know the deal. All right. Anyway, here we go. Question number 15. A male client arriving in the emergency department is receiving cardiopulmonary resuscitation from paramedics who are giving ventilation through an ET tube that they placed in the client's home. During a pause in compressions, the cardiac monitor shows narrow QRS complex and a heart rate of beats per minute with a palpable pulse. Okay. Which of the following actions should the nurse take first? So what is the very first thing that we do? Systematic. All right. Systematic. All right. Start an IV line, start an LV line and administer amiodarone 300 milligrams over 10 minutes. Check the ET tube placement, obtain an ABG sample, or administer amiodarone 1 gram. What are we thinking? Hey, shout out to all 300 plus y'all that are in here. We're doing NCLEX questions. We got them off nurseslabs.com. So nurses with an S, labs with an S. Make sure you guys put it in there. It's going to be a weird looking website. Okay. I want you guys to like that like button, smash that like button. Make sure you guys share. Make sure you guys follow. All right. Make sure you guys go over there and check that out. ABCs first. Okay. All right. Hey, and if you guys are new here, I want to know who you are, where you're from, and where you're at in your nursing journey. And if you're not a nurse, what do you do? And tell us about that. Tell us about it. Tell us about it. All right, y'all. I'm gonna give y'all 10 seconds. Got some people answering. Y'all better not make. I can't even read it, y'all. First of all, I'm calling RT. That's what I'm saying. Respiratory help. Help me. All right, y'all. Here we go. Here's our answer. Ashlyn, you say you're thinking about going to nursing school. Ma'am, you either are gonna go or you're not. You better make your mind up right now. Here we go. Here's our answer in 3, 2. And the answer is B. Check the ET tube placement. ET tube placement should be confirmed as soon as the client arrives in the emergency department. Once the airway is secured, oxygenation and ventilation should be confirmed using an end-tidal carbon dioxide monitor and pulse oximetry. KT, man, why would you tell her not to be a nurse? First of all, you could be a nurse, but there's different things you can do as a nurse. Hey, being an RN or being an LVN or LPN does not mean you have to work bedside. I said it. No part of me cares what you think. And that's on the dead homies. All right, here we go. Hey, real quick. Break time. Make sure you guys participate. I love you guys' participation. Make sure you guys keep it, right? OR gang, that's what I'm talking about. Yeah, so make sure you guys like, share, and follow, participate. Don't be selfish your whole life. Make sure you guys don't troll my chat. If you troll my chat, I'm going to ban you. Nurseslabs.com is where I got these questions. They are free. You guys can go over there and check them out. 7-day NCLEX course and tutoring. You guys can check those links out in my bio. As well, we're going to do an AMA after this. So if you guys got any questions, then hey, you already know what the deal is. Jason said, I work hospice. What's that? Office setting, RN, high risk, OB. I hate bedside work now, 95. That's what I'm talking about, girl. That's what I'm talking about. Hospice. I know a lot of folks that work hospice. Why do you call them clients? They are patients. Listen, I don't know where that dynamic changes, but somewhere the dynamic, they changed from patients to clients. And here's my thought process. They changed it to clients is because we provide a service to them. And essentially somebody has to pay that shit. So I don't like that term. I mean, they're patients. They're there to be taken care of. They're not a client. They're not giving me money to take care of them. But essentially, they have to give somebody money for them to take care of them. You know, it's a weird fucking dynamic. It's crazy. Here we go. Alvin and the Chipmunks with a massive pulmonary embolism We'll have a ABG analysis performed to determine the extent of hypoxia. The acid-base disorder that may be present is what? Metabolic acidosis, alkalosis, respiratory acidosis, alkalosis. What are we thinking? Alkalosis. Hey, if it's not lung, if it's not vomiting or suctioning, your default answer is metabolic acidosis. I'm just letting you know that right now, right? But we're talking about pulmonary, right? So 2 of those motherfuckers right now could just go away. 2 of them can go away. Just right off rip, okay? So here we go. Here we go, y'all. Here's our answer. Everybody's screaming C and D at me, right? That's what I say. Two of them can go away. If I see anybody pick A or B, I know where you are in your nursing journey. All right, here we go. Here's our answer in 3, 2. And the answer is D, respiratory alkalosis, right? The client with massive pulmonary embolism will have a large region and blow off large amounts of carbon dioxide, which crosses the ineffective alveolar capillary membrane more readily than does oxygen and results in respiratory alkalosis. That is the reduction of risk potential, right? 9 to 12%, 6 to 12%, something like that on the NCLEX, all right? Pulmonary, right off rip, pulmonary. Right. It says, my wife said she loves your teaching. Tell your wife I said thank you. I appreciate it. I love being out here teaching. That's what I like to do. I've been an instructor in the Navy for the last, it'll be 8 years in January. You know, I taught surgical technology. I'm a trauma nurse instructor now. On top of, I taught ACLS and BLS instructor. I was a burn instructor at one point. So I've been teaching for a while. I love teaching. It's kind of like my thing. All right, here we go. Question 17. After a motor vehicle accident, is it Armand? I'm gonna say Armand because that sounds real sophisticated. A 22-year-old client is admitted with a pneumothorax. The surgeon inserts a chest tube and attaches it to a chest drainage system. Bubbling soon appears in the water seal chamber. Which of the following is the most likely cause of the bubbling? Is it an air leak, adequate suction, inadequate suction, or there's a kink in the tube? What are we thinking? Shout out to all 400 of y'all that are here rocking with me. We are doing NCLEX questions, easy or not. I don't care if you think they're easy, but they're here, they're free, and free is a lot for me. Okay, so nurseslabs.com. Make sure you guys go over there and check that out. If you guys are new here, I want to know who you are, where you're from, where you're at in your nursing journey. And if you're not a nurse, I want to know what you're doing here, hanging out with us. All right. Make sure you guys like, share, and follow Active Duty. What is that Active Duty fun story? Oh, I got a whole bunch of Active Duty fun stories, but we ain't got time for that because we're doing questions right now. All right, y'all. Here we go. Had just one chest tube in about 15 years. Oh, Lord of mercy. Lauren, you're from Wisconsin. All right, cool. South Kakalaki. All right. I see y'all out there. Not a nurse, just curious. Mary, that's cool. I love the fact that people are curious and they're here. Love it. I love it, love it, love it. Engineering major, but I watch every season of Grey's. Stop it. Get out of here. Duval. Hey, look, I've been there. I was there for 4 years. Hey, here we go. Here we go in 3, 2. You're from Detroit Metropolitan. Memphis. Hey, y'all different out there in Memphis. I'm telling y'all that right now. And the answer is A, an air leak. Bubbling in the water seal chamber of a chest drainage system stems from an air leak. In pneumothorax, an air leak can occur as air is pulled from the pleural space. That is the reduction of risk potential. This is like, yeah, correct. Okay. Got my first nursing degree from Great Betty. Stop it. Stop it. Riley, stop. Y'all are wild out here. Hey, I appreciate it. Y'all funny. It says, already a nurse, just being nosy. Hey, keep being nosy, girl. You already know the deal. Hey, y'all are my brethren, or my sister is, y'all, nursing compadres. You already know what the deal is. Here we go. Question number 18. Nurse Michelle calculates the IV flow rate for a postoperative client. The client receives 3,000 mLs of lactated ringer solution IV. To run over 24 hours. The IV infusion set has a drop factor of 10 drops per milliliter. The nurse should regulate the client's IV to deliver how many drops per minute. Is this a study group? It's more of us just doing questions. But I mean, if you think it's a study group, you can come in here and hang out with us. Wait, what happened? Y'all talk. All right, what we thinking? Retired critical care nurse hanging out with boot nurse. That's what I'm talking about, Mary. I appreciate you being here. I appreciate it. B. Camille said 21. Okay. Not who is that? Not you doing math in the chat. That's what I love to see. I'm not doing any math right now. Hey, I ain't mad at you. Hey, those that are going to be taking their NCLEX, on NCLEX, you may, and I mean, you may have two like dosage calculations, maybe. Hell, I think the last time I took NCLEX, I didn't have any. Hey, by the way, I failed NCLEX, y'all, 3 times. Three. I bet none of y'all would have known that if y'all are new here either, right? So here we go, y'all. I'll probably tell that story. And if you guys want to even know more deep about the story, you guys can go over there and check out my YouTube channel. But here we go. In 3, 2, and the answer is B, 21. Look, somebody did the math in there, and that's the exact math that was there. 3,000 times 10, divide that by 24 times 60, because 24 hours in a day, 60 minutes in an hour, boom. And that's how we get our answer 21, right? 21. It's a knife. I mean, it's pharmacological and parenteral therapies, which is the second largest section on the NCLEX exam. All right. Do your thing, 21. Y'all are wild. I can't even with y'all. If I ever did a meetup, I already know that it would probably be the best thing ever. Ratio and proportion gain. That's what I'm talking about. Here we go. Y'all live out here. That's what I love to see. Here we go. Question number 19. Mickey, a 6-year-old child with a congenital heart disorder, is admitted with congenital heart failure. Digoxin at 0.12 milligrams is ordered for the child. The bottle of Lanoxin contains 0.05 milligrams of Lanoxin in 1 ml of solution. What amount should the nurse administer to the child? What are we looking at? I'm going to read y'all's comments right quick. How many nurses per square foot equal a wild party? Well, there's 370 something in y'all right now, so I'm going to say that. Hey, I'm just saying, I've been thinking about going to Nurse Blake's Nurse Con at sea. I'm just trying to tell y'all, hey, if I ever get to be a public speaker, like, and I get to go to that, I'm telling y'all right now, it'd be shout out to all 400 of y'all that are in here. Hey, make sure you guys like, share, and follow. Keep smashing that like button, y'all. Make sure you guys share. Make sure you guys follow. Answer in 10 seconds, y'all. I'm taking my NCLEX in December. How long will you tutor 101? I need to learn. So it all just depends on you. I've coached people and they passed in 2 weeks. I've coached people they got for 3 months. I've coached people for over a month. The last one the one I'm coaching right now is over 6 weeks, and another one I'm coaching right now just passed our NCLEX and it was over a month. So it all just depends on you. All right, here we go, y'all. Here's our answer. Here is our answer in 3. B for banana. Stop it. Here we go. Why am I so scared of the NCLEX? I don't know why you're scared of it, because it ain't scared of you. I don't know what you're scared of a test for. The best thing you need to do is practice for it. You practice for it. There's no surprises. There's no surprises at all. All right. Here we go. And the answer is B, 2.4. 0.5 milligrams divided by 1 ml equals 0.12 milligrams divided by X milliliters. And then 0.05X equals 0.12, X equals 2.4 milliliters. Obviously, I can't read. Pharmacological parenteral therapies. Shout out to all my math nerds that are out there. Your boy Kevin doesn't math well. I mean, I would have got that answer right, but it doesn't math well. Remember, it's simple conversions, y'all. Simple conversions. And you have to practice. Let them know. Some people like Nurse Mastery. I will tell you, it's like your NCLEX is on a computer. So why wouldn't you train that way? You know what I mean? What's the best way to reach you? Thanks. You can DM me. You can DM me through TikTok. Here we go. Question number 20. Nurse Alexandra teaches a client about elastic stockings. Paint the picture of what elastic stockings look like. And no, I'm not talking about no Halloween shit or anytime y'all want to go out to the club on Fridays and Saturdays. Okay. Which of the following statements, if made by a client, indicates to the nurse that the teaching was successful? So what did the client say that was correct based off of our teaching? That was also correct. I wear the stockings until the physician tells me to remove them. I wear stockings even when I'm asleep. Every 4 hours, I should remove the stockings for half an hour. I should put on stockings before getting out of bed in the morning. What are we thinking? Camille says D. Okay. Hey, I ain't seen Scorpio Princess in here in a minute. I really want to give her a 600, but she's not here for me to give her a 600. So. All right, what are we thinking? Hey, if you guys are new here, we got these questions off nurseslabs.com. You guys can go over there and check that website out for yourself. Also, make sure you guys like, share, and follow. That's the trifecta that TikTok likes. So make sure you guys like, share, and follow. I'm kind of cool sometimes, damn it. So y'all better be friends with me. Be friends with me. All right. Hey, I just saw a familiar name up in here. Hold on. Who that is? I saw Lovely Jess, ma'am. I knew that name looked familiar. I know you. All right, here we go, y'all. Here we go, y'all. Here's our answer. Here is our answer in 3, 2. Manasa. Okay, I see you. All right, here we go. And the answer is D. I should put on the stocking before getting out of the bed in the morning because it promotes venous return by applying external pressure on the vein. That is health promotions and maintenance. Yes, PVD. You already know. I'm a lawyer. Why am I doing these with you? Portia, that's because you love being here. You know what I'm saying? And plus, I may need a lawyer and, we may be cool and, you may do something pro bono for me. Whatever. Whatever. You know what I'm saying? But hey, health promotions and maintenance. This one is 6 to 12% on the NCLEX. Okay. Hey, remember when you guys are studying, read your rationales. Even if you got the question right, read it. Read it. That is how you retain the information. Manasa, what are you doing? Hey, here we go. Stop. Really? Y'all see that typing, right? She obviously doesn't know how to act. Hey, make sure y'all participate. Show Manasa some love. Hey, Manasa gets all the love. Hey, Manasa's the homie. You already know. Hey, Manasa was the first person that I coached, y'all. And she passed. She passed her NCLEX, y'all, because of me. No, not because of me. It was because of the work that she put in. All right. So anytime y'all are studying for anything, even if it's not with me, you got to put the fucking work in or else you won't be successful. Not at the NCLEX, but just at everything. All right. Hey, but participate because that is the key. All right. Like, share, and follow because you're not greedy. You know what I'm saying? Don't be greedy your whole life. All right. Hey, 600s. Hey, I ain't had to ban nobody yet, and I'm a little sad about that. But don't act up because I will ban that ass. Manasa, what up, girl? Woo woo. Nurselabs.com is where I got these questions from. They are free. Go over there and check them out for yourself. 7-day NCLEX course, $48. Black Friday, it is going away. The price is going up to $97. So I'm telling you right now, if you want, and you get it forever. So if you're an LPN and you're going for your RN, that means you get an NCLEX review that's going to be updated for $48. It seems like a no-brainer to me. Hey, and if you need one-on-one NCLEX coaching, you guys can go over there and check that link out in my bio as well. All right, here we go. Question number 21. The primary reason for rapid continuous rewarming of the area affected by frostbite is to what? Is it to lessen the amount of cellular damage? Is it to prevent the formulation of blisters, promote movement, or prevent pain and discomfort? So shout out to all 400 of y'all in here rocking with me. I appreciate y'all being here. Make sure you guys like, share, and follow. I got these questions off nurselabs.com. Make sure you guys go over there and check those out. But I want to know who you are, where you're from, and where you are at in your nursing journey. Not you, Camille, because I already know too much about you. But everybody else, though. Everybody else. What y'all doing? And if you're not on a nursing journey, what are you doing? What are you doing here? I already got a lawyer that on standby right now. Steph says A. All right, I'm going to give y'all 15 seconds. Becca, thank you for the follow. From PA, shout out to PA. Pharmacy folks, hey, shout out to the pharmacy pill counters, okay? Legal drug distributors, I see y'all. Plan to take your NCLEX soon. Pharmacy tech, okay. Caitlin, no lie, I thought you said like you're from Caitlin, Illinois. I was like, is that a real place? Is it Cheryl? Thank you for the follow. Is it Kanisha? You're in your first semester. ED Tech. Hey, shout out to all my techs out there. I love y'all. I'm trying to tell y'all right now. Hey, y'all are important. Don't let a motherfucker tell you that you're not. All right. Don't you ever let a motherfucker tell you that you're not important. Because trust me, y'all are a hot commodity, just like RNs and LPNs are. And just like everybody else, trust me. And shout out to my RTs. Hey, I learned everything I needed to know for the vent in the ICU from the RTs. So I love my respiratory therapists, all of them. Hey, and the answer is A. Lessen the amount of cellular damage. Rapid, continuous rewarming of frostbite primarily lessens cellular damage. A rapid rewarming is the single most effective therapy for frostbite. Heat conduction and radiation from deep tissue circulation prevents freezing and ice crystallization until the skin temperature drops below 0 degrees Celsius, right? That's part of physiological adaptation. Third largest section on the NCLEX at 14 to 17%, okay? Hey, remember, you're always going to hear me tell you the percentage of where it's at on the NCLEX, as well as you need to review your questions. That is where you retain all of the information that you get from when you're doing your content, you're doing your questions, and then you were reviewing the answers, okay? All right, here we go. Question number 21. A client recently started on hemodialysis, wants to know how the dialysis will take the place of his kidneys. The nurse's response is based on the knowledge that hemodialysis works by passing water through, a dialyzing membrane, eliminating plasma protein from the blood, lowering the pH by removing non-volatile acids, or filtering waste through a dialyzing membrane. What are we thinking? Hey, if you guys are new here, welcome. We're doing NCLEX questions. We're doing NCLEX questions. I want to know who you are, where you're from, where you're at in your nursing journey. Make sure you guys smash that like button. Make sure you guys share and make sure you guys follow. Make sure you guys do it. Okay. LPN student just got accepted to RN program. Yeehaw. That's what I'm talking about. That's what I'm talking about. Too much talking. Well, sorry, I didn't cover your ears if it's too much talking. I don't know if you know this. This is kind of my live. I'm just letting you know that. So, and plus I don't get to see y'all, so I have to do all this talking. Third semester. Mickey, appreciate the follow. BSN student from Jamaica. Shout out to you, Bran. Okay. Camille. Hey, Camille, you can keep your eyes closed. Keep your eyes closed. Keep your ears closed. Do it all. Do it all, boo. From Trinidad. Okay. All right, here we go, y'all. Here we go. Here's our answer. And 3, 2, and the answer is D. Filtering waste through a dialyzing membrane. Hemodialysis works by using a dialyzing membrane to filter waste that has accumulated in the blood. Dialysis largely replicates the function of the kidneys in patients with chronic kidney failure. Hemodialysis takes over the key tasks of the kidneys, removing waste material, toxins, excess salt, and fluids from the body. That is a reduction of risk potential. And yeah, there is that. You just got accepted to the University of Tennessee. Go Vols. You know what I'm saying? I don't know nothing about Tennessee. I ain't never been there. Maybe Nashville in the airport, and that's it. But hey, shout out to you for getting into Tennessee. All right, here we go. Question number 23. Ashlyn, appreciate the share. You love hemodialysis. That's what I'm talking about. Here we go. Question 23. During a home visit, a client with AIDS tells the nurse that he has been exposed to measles. Which action by the nurse is most appropriate? What is the most appropriate thing that you could do as a nurse? Administer antibiotics, contact the physician for an order of immune globulin, administer antivirals, or tell the client that he should remain in isolation for 2 weeks, right? Cass says B, tell the doctor. Tell the doctor. Ooh, call the doctor. Shout out to y'all. Shout out to y'all. Tell the doctor. Okay. All right, I'm going to give y'all 15 seconds. Hey, if you guys are new here, welcome. Make sure you guys keep smashing that like button. Make sure you guys share. Make sure you guys follow. All right? That's a trifecta. Don't be greedy. You already know, don't be greedy. I'm giving y'all this. You know what I'm saying? Y'all got to give me that. That's the least thing I asked for. You know what I'm saying? It's the least thing but I want to know who you are, where you're from, where you're at in your nursing journey. I want to know. I want to know what the answer is. And the answer is B. Contact the physician for an order of immune globulin. The client who is immunosuppressed and is exposed to measles should be treated with medications to boost his immunity to the virus. If the patient knows that he has been exposed to measles and his CD4 count is less than 200, right? Hey, think about that, your CD4 count, right? If it's less than 200, he should talk to his doctor about whether post-exposure prophylaxis with immunoglobulin may be an option. PEP may provide some protection or lessen the severity of infection if it occurs. If the CD4 count is 200 or greater, PEP can also include getting the MMR vaccine. Ideally, PEP should be administered within 72 hours of exposure to measles. All right. That is health promotions and maintenance. Hey, so you know what that means? Get vaccinated, I guess. You know, get vaccinated so we don't, you don't spread your nastiness. But hey, I'm just letting you know, you can do what you want, but Kevin is going to get vaccinated. I'm just letting you know. Just letting you know. I'm going to fall into that trap of being a drone, I guess, as some folks say. Hey, health promotions and maintenance. All right. It says germs are the biggest haters. They really are, right? They just come out here just thinking they can do what they want. Well, whatever. Here we go. Question number 24. A client hospitalized with MRSA, right? Ill. We all know what MRSA is, right? It's nasty. Is placed on contact precautions. Which statement is true regarding precautions for infections spread by contact? The client should be placed. The client should be placed in a room with negative pressure. Infection requires close contact. Therefore, the door should remain open. Transmission is highly likely, so the client should wear a mask at all times. Infection requires skin-to-skin contact and is prevented by hand washing, gloves, and gowns. So what are we thinking? I know one thing that y'all are thinking. Somebody's going to jump up in here and say easy money, right? And that may be true. But remember, everybody is in a different stage in their nursing journey or just journey, right? A hazmat suit, look, okay? I'm just letting you know. Yellow and everything. Like from Back to the Future yellow. Easy money. It's like, yeah, bish, it's D. I got you, girl. I got you. Hey, if you guys are new here, welcome. Welcome. I want to know who you are, where you're from, where you're at in your nursing journey. Sarah says D, 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 D. Yellow, everything for real. All right, T. All right, y'all, 10 seconds. Make sure you guys keep smashing that like button. Make sure you guys share. Make sure you guys follow. If you guys are finding value in this, make sure you guys keep smashing that like button. You guys share. You guys follow. We've had 2 people today pass their NCLEX. All right. And I will give everybody all the love in the world if you guys pass your NCLEX. I promise you that. And even if you don't, I will still be your greatest supporter. All right. Because just because you fail, it doesn't mean that you're a failure. Only you can determine what type of nurse that you're going to be. But the answer is D. Infection requires skin-to-skin contact and is prevented by hand washing, gloves, and gown. The client with MRSA should be placed in isolation. Gloves, a gown, and a mask should be used when caring for the client, and hand washing is very important. Yes, it is, because it gets rid of all the stickies and ickies. I'm a failure. Denise, you're not. Why would you think that you're a failure? You can't wait for RN school. Full PPE. I know that's right. Hey, I'm going in there with an N95. I don't care what you got going on. All right, y'all. But hey, safety and infection control, right? So, hey, sometimes like once you start to read the question, you're like, oh, I know what category that fits in. OK, y'all let Denise know that she ain't no failure right here. Hey, this is how we bring each other up. You know what I'm saying? Hey, I failed my NCLEX 3 times, y'all, and I could have given up. I was unsuccessful and then became successful. So I like to say we're unsuccessfully successful out here. I don't play games. You know what I'm saying? We don't fail around here. We figure it out and we fucking push. That's what we do. Here we go. Question 25. A client who is admitted with an above the knee amputation tells the nurse that his foot hurts and itches. Which response by the nurse indicates an understanding of phantom limb pain? The pain will go away in a few days. The pain is due to peripheral nervous system interruption. I will get you some pain meds. The pain is psychological because your foot is no longer there. And the pain and itching are due to the infection you had before the surgery. So what are we thinking? Abby, why you screaming at me? You scream at me? Oh, I thought you screamed at me. Oh, okay. I failed 4 times, but I won't stop. I know that's right. Is it Kareem? Last part is Kareem. I know that's right. I failed 3 times, y'all. And let me tell you something right now. No part of me gives a shit about what anybody thinks about me failing an exam. It's no different than failing a test while you're in school. I promise you that. Because your opinion of me has nothing to do with me at all. I'll go out there and we make some shit happen. You know what I'm saying? So like I said, it doesn't matter how many times you fail that exam as long as you fucking pass it. All right. And no one will ever ask you, hey, how many times you take it? Psh, I don't want you taking care of me. Get the fuck out of here. Who does that? Who does that? You know what I'm saying? Make it happen. All right, here we go. What are we thinking? Here's our answer. Here is our answer. And 3, 2, and the answer is B. The pain is due to peripheral, I said vascular, but peripheral nervous system interruption. I will get you some pain meds. You can also think about that being a therapeutic communication answer, right? So pain related to phantom limb syndrome is due to the peripheral nervous system interruption. A recent study estimates that there were about 1.6 million people with limb loss in the United States in 2005, and this number was projected to increase by more than double to 3.6 million by the year 2050. Vascular problems, trauma, cancer, and congenital limb deficiencies are among the common causes of limb injuries, and that's part of physiological adaptation, and that is the 3rd largest section on NCLEX at 14 to 17%. That's why it's so important that you read your rationales. Okay, read your rationale. Hey, if you got it wrong, understand why you got it wrong. Okay, and remember, not all of them are going to be perfect, but you're going to get enough to where you're going to pass. All right, but real quick, commercial break. Hey, we're doing NCLEX questions. Make sure you guys participate. Y'all are killing it today. Y'all are killing it, and I appreciate y'all. Make sure y'all share, y'all like, and y'all follow. All right, hey, if you're finding value in this, tear them shits up. Share it, follow it. Share it, follow me, and give me all them likes, all right? Don't be selfish. All right? Don't troll my chat. Y'all have been doing real well. I appreciate that, but I'm a little sad because I like banning people. Because I'm petty, over 9,000. Here we go. Nurseslabs.com is where I got these questions from. Also, 7-day NCLEX course. And if you guys need tutoring, those links are in my bio. You guys can go over there and check those out. Also, I'm going to do an Ask Me Anything after this in regards to NCLEX, nursing, whatever. And then, we'll get it on and popping. Here we go. Question number 26. A client with cancer of the pancreas has undergone a Whipple procedure. The nurse is aware that during the Whipple procedure, the doctor will remove the what? Is it the head of the pancreas, the proximal 3rd section of the small intestine, the stomach and the duodenum or duodenum, whatever, or the esophagus and jejunum? Jejunum. What are we thinking? What are we thinking? Camille says, I'm going to guess A. Okay. Cass, where you at? Where you at with your answer? Thanks to Grey's Anatomy. Stop it. Is it Ada or Ada? It said A. Okay. Call me Alice. I'll call you maybe. Fuck. I walked right into that. All right, here we go. She's right about Grey's. Look, I know, man. I don't watch Grey's Anatomy like that because I've been in the medical field too long. So I'm just like, All right, y'all. 5 seconds. Kevin, please, what says, please do this next semester too so I can pass my Abby. Look, I'm going to be here until y'all don't want me here. All right, here we go. Here's our answer in 3, 2. And the answer is A. Because Grey's Anatomy told me so. I'm just playing. Is the head of the pancreas. During a Whipple procedure, the head of the pancreas, which is part of the stomach, the jejunum and the portion of the stomach is removed. And, oh my God, anastomosis. Carter, it's closed. It's closed together. Damn it. Okay, there it is. It is the most often used surgery to treat pancreatic cancer that's confined to the head of the pancreas. After performing the Whipple procedure, the surgeon reconnects the remaining organs to allow the client to digest food normally after surgery. All right. What? Alice, you heard what I said? My bad. I can't. Anyone use the decision tree? Are you talking about the decision tree with Kaplan? I've used the decision tree. I actually like it. So, hey, but reduction of risk potential, okay? That is a smaller section on the NCLEX, either from 6 to 9 to 12%, all right? So just be aware of that. So yeah, user 39, I have used the decision tree. I used Kaplan when I took NCLEX, and I liked it. It was really good for me. No, you're good. I was laughing at your comment. Oh, my bad. I couldn't help myself. I'm sorry. Here we go. Question 27. The physician has ordered a minimal bacteria diet for a client with neutropenia. The client should be taught to avoid eating what? Packed fruits, salt, fresh raw pepper, or ketchup. It should be the ketchup and the salt. You know what? They don't need nothing. They can't eat. Hey, if you guys are new here, welcome. We are doing NCLEX questions. I got them off nurseslabs.com. You guys can go over there and check those free questions out for yourself. Also, make sure you guys like, share, and follow. Hey, I need to get to at least 20,000 likes, y'all. 20,000 likes. You know what I'm saying? Y'all got to get me there, all right? Don't be selfish. If you find value, kill it. All right? Also, I want to know who you are, where you're from, and where you are at in your nursing journey. All right? Oh, and by the way, if I'm talking too much, no part of me cares about you caring about that. But I love you, though. I love you. Here's our answer. Kat said, I did not RTFQ. Oh, Kat, you know what the deal is. All right, here we go. Here's our answer, y'all. Here's our answer in 3, 2. And the answer is fresh, raw peppers, right? We can't give you fresh, raw nothing because you ain't got no army to fight off nothing. You know what I'm saying? He said, nobody, no part of me cares. Look, I'm about love, okay? But I love y'all, though. Fresh, raw, or whole pepper is not allowed unless thoroughly cooked in food. A low bacteria diet is designed to reduce exposure to bacteria and other pathogens that can make one sick. It's often prescribed for people who are at greater risk of infection because they are currently not making enough white blood cells due to certain illnesses or medical treatments, health promotions, and maintenance. Read your rationales, ladies and gentlemen. Read them. Gonna kill them pathogens? I know that's right. I took my placement test to register for my classes yesterday. Shout out to you. Brianna says, I took my PN NCLEX today. It cut off beyond. Wait. Brianna says, I took my. Okay, Brianna, you good out here, girl. You good out here. Trust and believe me. It says, can't wait. Who said that? I can't wait until I'm Nurse Tanisha. That's what I'm talking about. Is it Tanisha? Nurse Tanisha, it's coming. Put it out into the world. You feel me? Put it out there. All right. And it shall be so. Here we go. Question. I know that's foggy. Question number 28. A client is discharged home with a prescription of Coumadin, also known as warfarin, right? The client should be instructed to what? Have a protamine done monthly, eat more fruits and vegetables, drink more liquids, or avoid crowds. I can and I will pass my NCLEX. That sounds like some Remar nursing right there. What is protamine? Protamine is the antidote for warfarin or Coumadin. It's the antidote. Luckily, I saw that. It says, yeah, I can. I'll pass it on the 20th. I want to take the NCLEX just out of curiosity. Yeah, until it humbles you, you're like, I wish I would have never done this. Alyssa says not A. Are you asking me? All right, y'all. Here we go. Here's our answer. And 3. Oh no, heparin, protamine, coumadin is K. I'm sorry. Vitamin K is for warfarin. My bad. Here we go. And the answer, yes, of course, is A. So heparin is protamine sulfate. Coumadin or warfarin is vitamin K. See, I knew I got that backwards. I was saying it in my head. That's what I thought. My bad. Let me not confuse y'all. Y'all go take a test and be like, let me tell you what this motherfucker told me on TikTok. See, y'all better stop listening to TikTok. Coumadin is an anticoagulant. One of the tests for bleeding time is a protamine. This test should be done monthly. The client will need to have his blood tested to tell how well the medication is working. The blood test called the prothrombin time, or PT, or protamine, is used to calculate the INR, or the International Normalized Ratio. INR helps the healthcare provider determine how well warfarin is working to prevent blood clots and if the dose needs to be adjusted. Health promotions and maintenance. Protamine, y'all. Did I say protamine again? See, look, I'm plugging up. My bad. Y'all know Protime. 4 times. That ain't it. But y'all know what the deal is. I appreciate you guys correcting me in a positive way. I appreciate you. But y'all know what I mean. Don't let me confuse y'all. All right, here we go. Question 29. The nurse is assisting the physician with the removal of a central venous catheter, right? To facilitate removal, the nurse should instruct the client to what? Perform the Valsalva maneuver as the catheter is advanced. Turn head to the left side and hyperextend the neck. Take slow, deep breaths as the catheter is removed. Turn his head to the right while maintaining a sniffing position. What are we thinking? Hey, shout out to everybody that's new here. We are doing NCLEX questions. I got them off nurselabs.com. Make sure you guys keep smashing that like button. Make sure you guys share and make sure you guys follow. You know, it's pro time out here. You know what I'm saying? It's pro time. Oh, I want to know who you are, where you're from, and where you're at in your nursing journey. All right. Keep smashing that like button. Keep sharing. Keep following. All right. That is the trifecta. If you guys are finding value, you guys keep doing that. All right, what are we thinking? We got C. Alyssa says C, 100%. All right, you sure about that? And that's not me questioning you. I just want to make sure that you're standing on top of that hill and you scream that answer loud. So, all right, y'all. Here's our answer. Here is our answer in 3, 2, and the answer is A. Perform the Valsalva maneuver as the catheter is advanced. The client who is having a central venous catheter removed should be told to hold his breath and bear down. This prevents air from entering the line. You got it wrong? Woo, bruh. Hey, so here's the thing. You're not expected to get all the answers wrong. I mean, you're not expected to get them all right. I don't like that. I don't even like the way that this is even worded because it's worded funky, right? So it says to advance, but why would we advance something if we're going to remove it, right? Okay, and you guys will get it. Say, why advance if removed? I'm with you. All right. Hey, remember, these aren't my questions. I need to repeat nursing program. No, you don't. Stop it. So here's the thing. A lot of these questions you're going to get are going to get funky. They're going to get funky because, they're made by humans. They have human errors. It doesn't matter if you have UWorld. It doesn't matter if you have Kaplan. It doesn't matter if you have Archer. I have used all of those and they have errors in there. And this one is written poorly and written wrong. So we're going to omit this one. We're going to omit it. So nobody got it wrong. Everybody got it right. Yay. On to the next one. Okay, there we go. I need to remediate reduction of potential. Sounds important. Camille, it's very important. It's very much important. All right, here we go. Question number 30. All right. Bell, I know. I got you. Hey, I appreciate everybody for following and listening to me run my mouth. But here we go. A client has an order for streptokinase. Before administering the medication, the nurse should assess the client for what? A history of streptococcal infection, allergies to pineapples and banana, prior therapy with phenytoin, or a history of alcohol use. What medication? All right, what are we thinking? Alyssa says B, I think. Okay, I'd rather you guess than not did not do it at all. All right, you have a 25% chance of getting it right if you don't know the answer. All right, but remember, always apply what you know versus of trying to apply what you don't know. If you apply what you know, you can. It really helps with the process of elimination. Okay, I'm gonna give y'all 15 seconds. All right, if you guys are new here, welcome, welcome, welcome. We're doing NCLEX questions. Got them off NurseLabs.com. Hey, we're gonna do an Ask Me Anything after this, so probably do that for about I don't know. 10, 15 minutes. Usually I get held hostage. So y'all be asking me all these questions. So Alyssa says I'm in first semester. Okay. Hey, if you guys are finding this helpful, make sure you guys smash that like button. Make sure you guys share. Make sure you guys follow. We need 20,000 likes. 20,000 likes, baby. All right, here we go. Here's our answer. Here is our answer in 3, 2. And the answer is A, a history of streptococcal infections. Clients with a history of streptococcal infections could have antibodies that render the streptokinase ineffective. I'm pretty sure I said it wrong, but whatever. Due to the streptokinase thrombolytic mechanisms of action, patients need monitoring for bleeding. The patient's thrombin time, prothrombin time, partial thromboplastin time, and complete blood count, and any signs of bleeding demand careful surveillance. Patients also need monitoring for signs and symptoms of reinfarction or vessel occlusion. That's part of the pharmacological and parenteral therapies. That's okay if you've never heard of that, man, because it's all about applying what you do know versus what you don't know. Like this could be one of those questions that the NCLEX pulls out if you start getting questions right. You know what I'm saying? Remember, it's a computer adaptive test. It's a computer I keep saying ProTime or ProTime, my bad. ProTime is the main character in IT. It really is. Obviously, I don't know how to read, but I'm getting better. I'm getting better, I promise. So, but I appreciate. I'm not a nurse, and I got it right. Shout out to you. Is it Dove or Dovey? Appreciate you. What score do you need to pass the NCLEX usually? So there is no score, but if you do it based off of a 0 to 100, you need a 50 or above. You need to get at least half the questions right. Okay. And pharmacology is a monster. It's the second largest section. But hey, ladies and gentlemen, that is a wrap. Hey, but we're going to do an Ask Me Anything after this. So if you guys want to hang out for a little bit, you guys can turn this camera around. You guys can look at my hideous face and we can get it on and popping. All right. But I appreciate everybody hanging out, participating. I appreciate all the love, the likes, all that. Like, I really do. I really do love being here. I promise you, or else I wouldn't get on here 3 times a week. Hell, I thought about getting on here every day, but probably not. Once again, I didn't have to ban nobody, and I'm a little sad about that. So I'm on Friday when you guys show up, I'm gonna need for y'all to bring somebody so I can ban them. Like I said, I'm not gatekeeping. I got these questions off nurseslabs.com. Okay. You guys can go over there and check those out for yourself. If you like them, if you don't like them, whatever, at least it's something that's out there for you. Okay. 7-day NCLEX course in its pre-launch phase, $48. It's going away on Black Friday. That link is in my bio. Also, if you want one-on-one coaching for NCLEX, look, somebody passed today that I helped coach. Somebody passed. And she's happy because she's a nurse now. So if that's something that you need, that's something we can do. Do you coach? And I do coach, actually. So yeah, that is my little spiel. I'm going to turn this camera around so you guys can see my hideous face. And then we can get it on and popping. What's up, y'all? Hey, I don't know if y'all notice this right now, but I got that smooth filter on. I don't even know what's up, but what's up? Shout out to all 300 plus of y'all that are in here. All right. Hey, a little bit about me. My name is Kevin. I've been a nurse for 3.5 years, in case no one heard me say that at all. Been a nurse for 3.5 years. Been in the Navy for 16 years. The road to retirement is, I'm at a downward slope now. You know what I mean? So, but I failed my NCLEX 3 times, y'all. And just like I told y'all, no part of me cares about what anybody thinks about me failing that exam. I've had nurses that were 20 years that said that they would never, ever let me take care of them because I failed that exam. And I was like, well, fuck it. I guess you're going to die then if I was ever your nurse, if you don't want me there. First of all, I would never do that. But, but yeah, like I love teaching. I've been an instructor in the Navy. I'm a master instructor, actually, in the Navy. I teach a bunch of other courses. So I love teaching. It's like one of my favorite things to do. Actually, I make this like my thing. That's what I like to do. So education is where my realm is at. It says Duval nurse wants a military nurse. Hey, I can get you one. Do you like Navy or RN? So, I was in the Navy for 16 years. I like the RN aspect, but I don't like bedside. What it means deployment. What do you mean, Karen? What do you mean? How does the NCLEX to RN different from LVN? Black Heart. Shout out to you. So what I'll tell you about that is that there really is no big difference except for you need to know what you can and can't do and what you can and can't accept. But the content that you learn when you're studying for NCLEX, it's all relatively the same. It's all relatively the same. Yeah, Jason Derulo, I got you. Are you still active duty? No, I'm in the reserves. Camille says, well. A nurse, Jason Derulo. Yes. Y'all want an autograph? I'll send you a shirt, whatever. Hey, Kevin, congratulations on not giving up and making it. I'm currently in nursing school. Is it Los? I appreciate you. You're going to get through it too. What area of nursing are you in? So I've worked ICU, I've worked PACU, and I work OR, and currently my place is OR. I was in the Army for 6 years, so I won't get at you hard time for being in the Navy. Hey, look, you weren't going to get me to join the Army. Look, I'm from Fort Hood, like the Killeen area. You already know the deal. No, absolutely not. Sonia said, you're the best. Ma'am, you are the best, and I appreciate you being here. Have you worked with nurses educated in Puerto Rico? I have actually. I've actually coached two nursing students or two nurses that worked in Puerto Rico to take their NCLEX here in the States, and they both passed. And that was about a year, probably about 2 years ago, probably like when I first started. And I've been coaching since I've been a nurse, I've been coaching other nurses. I hate bedside. All I did was pass meds. Look, you could do more than that. Where are you? I live in Texas, baby, specifically in San Antonio. I failed my first TESI. I need a 900 and I got an 822. Now I'm about to sit for the NCLEX. Ernisha, we done already talked about this. Do no harm, but take no shit. Facts. I don't take no shit from nobody. Like, you ain't gonna come play with me like that. Kathy, thank you for the rose. Can we go into the Air Force? Yeah, absolutely. So Army, Air Force, Navy, you can go into nursing. Marine Corps doesn't have that because the Navy is the medical aspect of the Marine Corps. So you can go all three of those. What did that say? It says, what's y'all's recommendation on studying for the HESI? The Elsevier book. That's my opinion. I am still in school, but the struggle is real. I bet. Oh my God, I was there. You were where? Allwill. Do you think I should challenge the LPN board? Exam 6 months before the exam. I'm almost done with my RN school. I mean, June, that's up to you. That's up to you. If you want to study for it and take it, and if you're going to go out there and work as an LPN, cool. But I mean, you're going to go take your exam in 6 months anyway. So that all depends on you and what you want to do. Let the Army versus Navy game handle that. Hey, look, I'm letting you know right now, I was going to go to it last year and this year, but I'm definitely going to it next year for sure. I'm a cardiovascular sonography student, but love watching your vids. I appreciate you, Phoebe, appreciate you. What do you think of mental health nursing? I'm considering. Mental health nursing is needed, y'all. Like, it really, really is. Like, for us as providers, but then also for everybody. And mental health is very, very, very well needed in the military. If you know, you know. I'm just saying. Did you ever plan on being a professor at a university? I did not. Never planned on that. Do they have RN FAs in Texas? 100% they do. What was my favorite specialty? You talking about like as a nurse? I loved working in the burn ICU. Loved it. How are the STs in the OR? They're pretty cool. The ones that I work with were pretty cool. I was a surge tech for 13 years, y'all. I was a surge tech instructor. So I know the surgical realm pretty well. RNFAs are not a thing in VA. That's unfortunate. So we had an RNFA who went to go be a nurse practitioner. And now she's a surgical nurse practitioner. So it's very much a thing. What would you recommend to make my nursing application stronger? Volunteer at the American Red Cross at a hospital. Do that. That will make that application stronger. I promise you that. Do you pronounce it Del Nido or Del Nido cardio? I don't know. I don't pronounce it either way, I guess. Which department did you like the most? The OR, ICU? Oh yeah, ICU. How do I change the NCLEX if I never graduated from the program, but I have all my credits? If you don't have essentially like a degree, and if they don't send your credits, like you can't take the NCLEX if you don't have a degree. You live in Texas. Shout out to you, ma'am. Shout out to you. Any advice for nursing fundamentals, please? I'm in my first semester. First of all, I bet you nursing fundamentals is what's the word I'm looking for? Humbling that ass, as I like to say. Right. So one thing I'll say is get into a small group of people, you and 3 other people, split it up into even 4s. You do 25% of the work. You reap 100% of the benefits if you do it right. All right. I want to be a nurse for the VA. So all you got to do is just go to usjobs.gov and you got to apply. Biggest thing about applying for government jobs, though, and any job is that they have AI. They have AI that actually monitors their applications. So go to the description. This is for anybody trying to look for a job. Go to the description of whatever the job title is, and then drop it in the chat GPT, and then put all the things that you like. Say, hey, I need this for a resume. It'll spit it out in like 5 seconds. All right. So failed pharmacology, so I have to sit out a semester help. Well, you better start studying. Is it a Carmel? Did I say it right? You better start studying for pharmacology. Hey, some really good videos that are out there. YouTube. Hey, listen to me. YouTube has some great stuff out there for pharm. Just some motivation for those who want to judge because you failed the NCLEX. Keep pushing facts. Fort Hood. Yeah, I was there. That's where my family lives at. So I have a bachelor's in chemistry. Can I just join? Join what? Oh, boomer, join what? Yo, I'm like 52 something comments below. I might have to. How long should I study for the NCLEX after school? You should be studying before you get out of school, and then you should take the NCLEX as soon as possible. African educated and want to take the NCLEX. Any advice? I would study for it 100%. And then also you need to see what the criteria is in order for you to sit for it. Okay. Hospice nurse. I'm going to keep scrolling because you guys respect third. Oh, the surge text. I'm in the Navy. Jeanette, you are in the Navy. Shout out to you. Respect the surge text. I see you. Current RN. Should I go with Archer or UWorld? Either one is good, Lauren. It just depends on you. Like Archer is a little bit cheaper than UWorld is. Actually, it's a lot cheaper than UWorld in my opinion. It's about the same. But it all just depends on you. I like Archer. When I was studying for NCLEX, I did not like UWorld at all. That's just me though. It says when I was on the floor, I refused to be a nurse, but when I was in the ED, I decided to be a nurse. Wow. Cool. I like that. I really like the ICU. Did you ever consider CRNA? I did actually consider CRNA school. And then I was just like, I don't like this anymore. Like, I just didn't like it anymore. And then plus the ICU that I was in just kind of, in my opinion, just really started to set people up for failure. They were doing a lot of unethical things, and I just wasn't a fan of it. So is it Soraya? What's up? How are you? What do you think about test banks? Is it worth it? What do you mean test banks? You got to elaborate a little bit more for me. When a nurse is seeing what a patient knows about an inhaler before teaching which nursing process? I don't know what you're asking me. If you're asking me about a nursing process, you should probably be asking yourself about that nursing process. Hey, that's another thing as well. Go to nurseslabs.com. Like, you find the NANDAs and all kinds of stuff there if that's what you're asking. Know the pay average. What are you talking about, LJ? During pathophysiologist semester this semester. Okay, simple nursing for pharm. Facts. I like simple nursing's videos for pharm. I use those all the time. Or when I was in school. Any advice on which specialty is worth it for a new grad? Kevin, I'm just going to let you. First of all, your name is Kevin. My name's Kevin, so shout out to you, sir. But one thing I will tell you is that you need to go to where you want. Everybody will start to tell you need to go to med-surg. But if you don't want to go to med-surg, go to somewhere else. But there are some places that will not even take you unless you have a certain level of experience. So if you don't know where you want to go to med-surg. But I'm telling you right now, the money is not worth it. At the beginning, you need to get the training. I'm telling you, hindsight is 2020. If I could do it all over again, I would have went to a level 1 trauma facility, and I would have just done things differently. It says MA Nursing Board won't approve my license because my school is not accredited from the national board. And that's one thing I try to tell people is, like, you have all these schools that are popping up. If they're not accredited, then you're like, it was a waste of your time, and they took your money. User 20. That's exactly what they did. They took your money, and that's unfortunate. That happens a lot, and I'm sorry that happened to you. Because that's what was happening during that Operation Nightingale and all other stuff. Quick question. Do you work with the system ATI? I have never used ATI. I have a couple of friends that did, but the school that I went to, they used HESI. Any suggestions? I'm planning to go for my RN, but I want to work as a nurse while in school. Are you a LVN? User 20? Is that what you're saying to me? Currently procrastinating studying for my pediatric exam. I'm going to need for you to not, and I'm going to need for you to go handle it. I know everyone's NCLEX is different, but were there common topics you saw in the NCLEX? So here's the thing: is that you have to be familiar with all the topics, right? And no, your test is going to be very different because your test is computer adaptive, right? So based on your answer, it'll determine whether it gives you an easier question or a harder question. So everybody's test is going to be different because your answer, your test is based off of how you answer. Okay, is simple nursing pharma good? Yes. What did you not like about UWorld? Me personally is like, I feel like the rationales were too much in depth. I had a huge content issue, so they didn't provide content videos. I'm not sure if they provide those now. And then that was probably the biggest thing. It's just like they didn't give content. So that's why I actually went from there, and I went to Kaplan, and I loved Kaplan, and I paid a little bit more extra for that, and I was cool with that. Having a stressful time in my 11-month LVN program. Do I have any hope for surviving for RN program? Is it Glossmuse? That all just depends on you, right? Like, if you don't, like, here's the thing: if you're scared Or if you can't do the stretch, remember, going to nursing school, I'm talking about the whole process. Nursing school, the entrance exam, all that stuff. Graduating, going for a higher level scope of practice. It's meant to be difficult. It's meant to be stressful. It's meant to keep people out, not just let people in. So you have to accept the fact that it's going to be stressful. You got to get through it, because if you don't get through it, you're eventually going to succumb to, fuck this, I don't want to be here. But in reality, if you want to make it work, you got to make it work. Like everybody that's a nurse walked the same line as you, and we all had to tell ourselves the same thing, right? And that's why I like mentoring, because I like talking to people like you to tell you, like, hey, dust that shit off, stand up, and let's audit something and let's see what's going on. Let's trim the fat, so see if you can get better at it. Okay, school won't let me precept. In school, do you suggest pre-op, PACU, or ICU to get my foot in the door? I like PACU. I love the PACU. ICU was great too when I was learning a bunch of stuff, but then, best research for ACLS prep. What's a really, man, I'm drawing a blank on that one. I'll have to get back to you on that. Shout out for the advice, bro. You're welcome, Kevin. No problem. What's better, Saunders 9 or 8? Well, you can never go wrong with the most updated Saunders book. Do you like the Saunders Comprehensive Review? Did you ever use it? I use the Saunders Comprehensive Review only for HESI. After I got out of school, I couldn't use Saunders because to me, I was just like, why do these questions seem so easy? That's me though, but to me, it helped while I was in school. For anyone struggling with MedSurg question formatting, get the book MedSurg Success. Okay, that's a good one. How to remember side effects of pharm. So you got to know. So it's based off of the families. That honestly. So like cardiac meds, you're going to be thinking about heart rate. You're going to be thinking about blood pressure, orthostatic hypotension, stuff like that. You're going to be thinking about higher, low potassium. You're going to be thinking about electrolytes. Like, honestly, it just comes to you getting down the dirty and practicing it. Are you Navy? Yes, I am. Can't precept in the OR. Should I precept in? Why can't you precept in the OR? What made you switch from ST to RN? My deployment when I went to Afghanistan. It definitely feels like a hazing process. It does feel like a hazing process because essentially you have these old crusty ass people that are trying to hold nursing at a high pedestal, so they want to try to keep people out. But you can't keep everybody out. Yeah, if people put in the work, you have nothing. They try to treat it like the good old girls club, and I say girls because it's 89% women, right? So, you gotta navigate your way through school, and you gotta navigate your way through nursing in order for you to find something that you like. Like me, I love teaching. Bedside is not my thing. I did my bedside thing so I can actually, relate to everyone else. But other than that, no sir, no ma'am. Spicy says you are motivating me around. Hey, spicy 5-star. That's what I do. That's what I do all the time. You're welcome. Explorer page. Do you do NCLEX tutoring? I do. You can go over to my page. You can go over to my link in my bio. Click on the link tree, and the second one down, right there in front of you, it'll say NCLEX coaching, 1-on-1. So you can check that out as well. Okay. Any tips on dosage calculation? That's all about practice. Was it Oliver and Oreo? That's all about practice. You gotta do questions, and you gotta do that is repetition. There's no other way to get through that. Is PACU a good place to start as your nursing career? Spicy, thank you for the heart. Will a hospital hire a newly? Yes. Like I've seen, like in my hospital, they hired like 1, 2, like 3 or 4 new grads to go in there. Me, when I went to the PACU, I had already had ICU experience, so they loved me. Do you have a brother? I don't. I have nothing but sisters, actually. Them old nurses that eat their young. Thankfully, I am not one, even after almost 20 years. And that's good. That's good. That silly nurse. That's good. Because I can tell you right now, there was an older nurse who tried to eat me. That sounds kind of weird. Yeah, let's keep it weird. Anyways, she tried to do that to me, and I checked her real quick. And then after that, I was just like, hey, I'm not your son and I'm not your husband, so I don't know who the fuck you're talking to. I was like, if you got something constructive to say to me, we can talk about that. But don't sit here and degrade me, because we will really have a problem. And then I end up in HR, so whatever. Is the pay worth it to be to be a Navy nurse or stay civilian? The pay, in my opinion, I think it's great. But you don't get paid as a nurse. You get paid as an officer. Okay, because everybody's paid on salary, right? But then you can get specialty pay as an officer, as a nurse corps officer, based on your specialty. So ICU, OR, if you become a CRNA, nurse practitioner, so on and so forth. Appreciate the rose. It says 2020 changed a huge dynamic in those willing to walk in knowing scary versus those who true. You're right. Facts. Kari says, hey, I love your lives. Kari, hey, look, I appreciate you being here. You're here all the time. So is it Farah? Thank you for the crown. I appreciate you. You know what I'm saying? Just, that's what we do. It says, what do you think about Mark Clemick for NCLEX content? Love it. If you have his audios, use them. Love it. Because I love, that dude's like my idol. And he's like one of the like driving forces in my brain on why I created an NCLEX course. All right. Do you mentor throughout nursing school or just NCLEX? Christy, I just do NCLEX. But, you know, I have different phases in my mind of what I want to do. So I eventually do want to get to the nursing school aspect. Let's see. We laughing. How do we manage multiple nursing classes? You honestly write them down. So if you're probably taking 3 classes at a time, who is that? Jackie? There's always Jackie. I'm sorry. But the one thing I'll say to you is that you really got to write them down. Even if you got to get in an Excel spreadsheet, you got to like lay the time out. Time yourself, you know, like what are you doing from 8 to 10? What are you doing from 10 to 12? You know, you got to give yourself and follow those Excel spreadsheets if you write it down. And that's what I had to do because I had a whole bunch of stuff going on. So time management. Spicy says, I am so struggle with farm. I failed it once and I have to pass farm and to move on to med surge. So, ma'am, that is practice, practice, practice. I'm telling you right now, practice, practice, practice. What's up? Was it Gaz? What's up? Been missing your lives. Yeah, you have, Joanna or Jonah. You have been trying to grind and get through school. So deleted TikTok. Hey, I ain't mad at you. The distractions. I ain't mad at you. I'm taking 4 nursing classes. All right, split them up. Hey, get it on a piece of paper or go on an Excel spreadsheet. Lay out your time from 6 a.m. one day to 6 a.m. the next day. And then literally plug in. What are you doing? Waking up, taking a shower, walking the dog, extracurricular activities, whatever. Study, whatever, however you need to audit yourself, however you need to trim the fat. That's what you have to do. I had to do it for myself, and that's what you have to do as well. That's for you, Jackie. Okay, perfect. Thank you. You're welcome. Cool. Hey, I caught up on all the questions. I'm going to hang out probably for like another 5 minutes because I got stuff to do. Hey, I just want to let you guys know. If you guys are studying for the NCLEX, right now I have 44 videos up, and I have part 1 and 2 of my new generation NCLEX review. Essentially is where I'm reading questions, we're reading the answers, and we're essentially kind of breaking the questions down, going through rationale, so on and so forth. Y'all, there's going to be 100 questions of that. 100 fucking questions. You feel me? As well. And by the way, I don't curse during my lectures because I know that's not everybody's cup of tea. So I try to back off on the Navy a little bit because it's a little too stressful for some folks. So that stuff is in there, and other videos are coming. The actual 7-day review that I'm going to be putting in there as well is going to go over management of care. It's going to go over reduction of risk potential, pharmacology, you name it. It's all going to be in there. Okay. But your boy's only one person. Got a camera right here. Got some stuff back here. You know what I'm saying? So we are churning and burning it and getting it out. That's what we do. Currently in ST school, about to finish in 5 months. My plan is to go and get my BSN. Need advice. Well, if you're in ST school, finish ST school. All right. And I would write down your plan. You see that board right there? That's like my memory board. It's all over the place. You need to start writing stuff down and write out a direction that you need to do for yourself. Okay. It says, oh my gosh, I need that. I feel like I'm so behind. What, Jackie? Oh, you're talking about like that Excel spreadsheet that I was telling you about? Look, you better make it happen. You better get out there and make it happen. Okay. So, but yeah, make sure you guys go over there and check that out. Also, if you buy it for $48 right now, you get it forever. That's my pre-launch gift to everybody. Like, this review is going to be so dense, y'all. Like the whole thing, like you get content, you get an NGN review, and then you get the 7-day review, which I'm working on right now, which is going to hit the 8 sections of client needs. You know what I'm saying? And that and the NCLEX question review. Where do we get it? Jackie, if you want to check it out, go look. The link is in my bio. Click the link. You'll see 7-day NCLEX course. Click that. That'll take you there. Also, if anybody's looking for one-on-one coaching where we break down questions together, you get one-on-one hour sessions with me. We create calendars. We create trackers. You know, we talk about nurse mentorship, like how to move throughout your first year of nursing, second year of nursing, landing your first job. You get like the way that I conversate like this. That's what you get. You know what I'm saying? Like the same way that you get right here is the same thing you would get with one-on-one coaching. I promise you. It's just, it's a little bit more in depth and it's a little bit more, personal. I coached a young lady for the last month. I actually have 6 people in my coaching right now. I only do about 10 a month, but I have 6 people in my coaching right now. One young lady I coached over a month. She took her NCLEX on Monday, got her results today. LVN. I got it on tape, y'all. She screamed and she's crying. She was crying because all that fucking work that she put in, just like the work that y'all are putting in. You know what I'm saying? It says, be careful with those one-on-ones asking, do you have a brother? You right. I ain't got no brother. I didn't even think about that. Who asked me, hey, LJ, who asked me if I had a brother? That didn't even register because I was going through all the questions. All right. But yeah, those two things that are available to you, the 7-day NCLEX course, as well as the one-on-one NCLEX coaching. Okay. But yeah, real quick story, y'all. I failed my NCLEX 3 times. 3. Once in 2018, twice in 2019. And then I passed it again right when COVID started, or right in the middle of COVID, June of 2020. And let me tell you something that I learned from it. No one fucking cares, yo. No one cares how many times you've taken that exam. No one. The best thing, I'm gonna tell you the best thing about me failing that NCLEX is that it brought me here. Like, it got me here to y'all. It let me coach. It brought in a wealth of experience by me experiencing all those unsuccessful attempts, all that shit, all of it, you know? And so what I'm saying to you is, it doesn't matter if you failed that exam. It's not going to determine what type of nurse that you're going to be. All the nurses that are in here, let them know that it doesn't matter what type of nurse that you're going to be. Only you can determine that. You want to go out there and be a fucking shitbag, then you're going to be that means you're already a shitbag. You're going to be a shitbag nurse. You want to go out there and be redondant and fucking do medication administration and fuck up and kill somebody, then go. Cool, do that. Do you. But if you want to go out there and you want to take care of patients, and then you want to go out there and excel within your nursing career in all aspects of nursing, not just bedside, then you can determine that. No one's ever going to fucking know how many times you failed that exam. Ever. So keep your head up when it comes to all that shit, okay? Don't let this test beat you. All it is just a test. You fail it, you fuck up, you audit yourself, you go back to the drawing board, see what you didn't do well, reattempt, and keep doing it over and over and over. Yeah, I'm definitely going to reach out one time in my last year for coaching. Okay, shout out to you. It says, is that psych nursing kicking in? Do you have a brother? No, sir. I do not. I think somebody's trying to play me like that. You know, so I need coaching for every class. I can't help you with that. I mean, I can definitely help you with NCLEX, but I cannot help you with every one of those. I mean, I could, but that would be a hefty. We would have to talk about that. Jackie says, what's the difference between the old NCLEX and the new generation? So, Jackie, I'm glad you asked that question. So the new generation NCLEX, okay, so here's the big difference. The difference is how the questions are delivered to you. So the old NCLEX used to be, or the old version of the NCLEX used to be just select all that apply, multiple choice, click and drag. The matrix one, like the grid where you can point and be like, hey, this is where, you draw blood from when you're doing a blood glucose check, stuff like that. But now 60 to 70% of your exam is going to be multiple choice, select all that apply. The other 30 to 40% is going to be like case studies, right? So they're going to give you everything that you could ever want. Okay. So they're going to lay out, hey, your patient came into the emergency room, walked in with their spouse complaining of having chest pain, yada, yada, yada. You have the health and history, you have the vitals, you have the labs, you have all of that. So essentially the case study walks you through as if you were taking care of a patient from the beginning of your shift to the end of your shift. Okay. And that's 30 to 40%. And inside of those, you get bow tie questions. You get what we call the extended multiple choice. You still get select all that apply. They have other ones that are like anticipated, not anticipated. You still get dosage calculations. They have the close or the drop down as well. And those are essentially like fill in the blank. Okay. So the content hasn't changed. It's just how it's delivered to you, if that makes sense. And if you guys are finding value, make sure you guys keep smashing that like button, okay? Let me see what we got. It says they added interactive case studies. Correct. That's pretty much what I said. Time for dinner. Thanks for the session. You're welcome, Fry. I know Fry's already gone. It says nursing has been sold as a carrier money base. But if you do it because you love and care and connection, facts. Yeah. I don't know why I just read that like I was all slow. It will be the best blessing, facts. So that's the thing. It's just like, here's the thing. People do not become initially, people not become nurses because of the money. You become a nurse because you want to truly take care of people, right? I can tell you right now, nursing is not where the money is at. Where the money is, at least bedside nursing, that's not where the money's at. The money is outside of bedside nursing, right? Like you can go out here and get you a remote job making anywhere from $80,000 to $120,000 sitting at home, doing stuff on the computer and not wearing any pants. Like, who doesn't want to sit at home and not wear pants? You know what I'm saying? So, or you can go out there and do nursepreneurship, or you can go out there and, you could do all kinds of stuff out. You could be a travel nurse. You can do all kinds of stuff. I'm trying to tell you. I heard there's one lady that I follow, and she specifically says, you are the CEO of your nursing license. Did y'all hear what I said? You are the CEO. You are the chief executive officer of your nursing license. Once you get it, whether you're an LVN, LPN, or an RN, there's so many fucking opportunities out here. It's like people really don't understand, right? And what I'm telling y'all right now is what I tell people in my one-on-one coaching. This is what I tell people, right? There's so many other things that you guys can do out here, right? Jackie says, okay, that makes sense. I just wasn't sure what to expect. I still need 1.5 years, but I need to prepare. Jackie, you'll be prepared. I think that you'll be ready. What are the basics I need to know as a nurse? Time management. It's basic. That's time management, medical administration. Those are by far the largest. And then of course, your critical thinking, clinical judgment. Honestly, everything from school that's encompassed about being a nurse, you have to know it. Yeah, money is in travel nursing since 2020, but you are always moving. Yeah, I mean, honestly, if you really want to know where the money is at, it's right now. It's in remote nursing. I mean, remote nursing, you get a big bang for your buck, but not as much work. AKA, you're not traveling, you're not doing a whole bunch of stuff. But hey, you gotta watch the traveling because them taxes are gonna get you, right? But if you know what you're doing, you'll be all right. How much is the charge for coaching individual? Is it Sabita? You can go to the link in my bio where it says NCLEX one-on-one coaching, and my coaching page will tell you everything that you need to know to include what the coaching consists of. Okay. It says nursing is like a buffet. You have many options to select from. Exactly. But you want to know what they tell you in school? Go to med-surg, go to bedside, go do that. Your patients need you. That's what they tell you. Right. But what they won't tell you, because they'll be like, I worked bedside for 17 years. Why? Why the fuck? Why did you do that? Did you like it? Because if you did it because you like it, that's different. You know what I mean? I have an exam next week and I'm super nervous. Hey, don't be nervous. If you're scared, go to church. LJ says, if you have family, find what you love. Doing rounds, find a facility, MD office, willing to pay you what you're worth. Facts. Where are you? Do you coach in person? I do not. I only coach via like by the computer, and I live in San Antonio. So, I mean, if I was to coach somebody in person, that would be a very different conversation. But right now I do online coaching. Any suggestions for fundamentals? Get into a group, split up all the information and share it. Go get experience first. What we talking about? HIV lady. I know you popped up in here. Exactly. That's what I was told. Yeah, Jackie, I bet you that is exactly what you're told. Oh, go to med-surg. Go get bedside experience. Stay at the hospital. Your patients need you. Granted, what I hate is people gaslighting me. Like, it's obvious that, patients need to be taken care of. But in the end, who the fuck's going to take care of you? Because I can tell you right now, these hospitals will get rid of you like you're a fucking dime a dozen and replace you with 2 other people and then pay them less. You know what I'm saying? If you want, I recommend everybody get experience. Go get some type of experience so you at least understand. But I do not expect for you to fucking stay there. I do not. They are desperate for reliable staff. They are desperate for reliable staff, but you can't get reliable staff when a hospital doesn't treat you right. You know what I mean? Hey, who is that? Is it Meraki? You don't got to spam. I already answered your question. How do you feel about Nightingale School, nursing school? I don't know. That you're the third person to tell me about it. I don't know any information about it. Hey, enlighten us though. Tell us about it. Just like a restaurant can't get staff same for reliable. Exactly, you surely can't. As a matter of fact, I was told today to do med surg. I bet you were. Did you just pick your nose, bro? I don't know. Did I? If I picked my nose, I'm gonna go back and I'm gonna look at the recording anyway, and I'm gonna keep it in there because whatever, fuck it. But no, I don't think I picked my nose. Let me see what we're saying over here. It says the hospital. I saw you pick it, fam. Well, fuck it, bro. If I picked it, I picked it. I don't fucking remember. I'm talking to y'all. The hospital. The hospitals sometimes run on bare minimum. So yes, know your worth and demand decent pay. So here's the thing. Good luck on demanding decent pay because they won't fucking pay it. And if they do, unless you go to like multiple different places, take your offer letter to HR and be like, hey, these hospitals over here are going to pay me more. Let's see if you'll pay me more. And if they don't, bye. Hey, at least you got a backup saying I got an offer letter and you got somewhere else to go. Because trust me, other facilities like surgery centers and clinics, they will pay you more. They will pay you more. My preceptorship as a new grad med-surg tele starts on Friday. How should I prepare and what to bring? All right, Catherine. So what I'll tell you is that you need to go and you need to be a sponge. Be a sponge, right? And then jump in. Don't be afraid because you got to be there for it. Jump in, ask tons of questions, take notes. All right. You're going to go through imposter syndrome and we all go through it. Okay. Yeah, it's me. And so you're going to go through imposter syndrome. All right. So you just got to be prepared for that. Med-surg is a struggle because for us, here, it's the catch-all and overflow. Yeah, because they're gonna throw everything at you. It says, "How about you moisturize, bro? Really, bro? I stay moisturized. You already know. You don't see this glistening on my forehead. The fuck do you mean? They want 5K sign-on bonus for a VI? Look, they offered me like 3, and I didn't even realize it. Guaranteed 3 years? No, sir. It's crazy that shows desperation. It does. Love you, man. Love you, bro. It's based in Utah, but mostly taught online. But we travel for a rotation 3 times a year for 6 to 8 days. I don't know. I don't know anything about that, honestly. I mean, I live in Texas. I don't live in Utah, so I don't know exactly how it is. So why you bald? You're bald. Am I bald? I don't know where I'm bald at. I do got a big ass forehead though. Like, no cap, as the kids say. But anyways, hey, appreciate everybody being here. Hey, what other questions you guys got? I'll be on for a few more minutes and then I'll get off. Because, I got things I got to go do. I got content I got to make for y'all. I got videos I got to edit. You know what I'm saying? So, it says, any Idaho, first of all, don't you ever, no, I'm playing. Idaho nurses, what's the remote life in nurse life there? What do you mean? Like, you could do remote nursing anywhere. So Jackie says, thank you for your help. Jackie, you're welcome. Hey, every time I say your name, Jackie, it reminds me of Jackie from that 70s show. So if I start quoting that show, you already know what the deal is. Is it SV Gall? It says, what's a good study method? I write notes out from PowerPoints, but it's not sticking. All right, so here's something. You love that show? Jackie, I'm just saying, we could be real good friends, Jackie. I'll just let you know. So a study method. So here, that's the thing. How do you best retain information? Right? Is it audio? Is it visual by you looking at looking at the computer where there's PowerPoints? Are they videos? Are they like Picmonic or like mnemonic stuff? Are you a read write? Stuff like that. So those are things that you got to think about. So once you figure out what type of learner that you are, that's how you apply your learning to your studying. All right. But one of the biggest things that you do have to do is that you do have to do content. You do have to practice your questions and your answers, and you have to review your rationale. So you have to. That is the trifecta. You have to do that. Okay. So that would be my suggestion to you. It says, I'm working hard to get A's in my LVN program. Is it worth it, or should I just settle for passing grades? You can get A's all you want, but I can tell you right now, no one is going to fucking care what your grades are in school. I want to know that you are a competent nurse, you have a license, and you can take care of me. That's what I want to know. Remote nurses are in demand, and I want to know if it's worth remote life. City girl asking, ma'am, let me tell you something. You a city girl? City girl? I'm sorry. But one thing I'll tell you, LJ, is imagine the work from anywhere lifestyle, and all you got to do is just be on your laptop. Answer that question. Do you like that? And that's your answer. And you already know if it's worth it or not. And have you ever seen a license plate from Idaho? Isn't it like a potato or some shit? Who they let in? What you mean who they let in? You right. That's what I'm saying. Hey, here's the thing. Personally, for yourself, this is for gloss. If you want to go out there and you want to get all A's, who am I? Who am I to tell you? Who am I to tell you, for you to not get A's? If that is something that you personally do for yourself for personal gratification, please continue to do it. But I'm telling you right now, I don't give a shit. I don't care. As long as I know, because guess what? You think I'm going to ask you if I'm your patient? Hey, Gloss, or whatever your name is. Hey, what did you get in fundamentals while you were in school? No one fucking cares about that. And I'm just being completely real with you. We don't care. I promise you. All right. So whatever you do, self-gratification for yourself, please, by all means, keep doing it. But it doesn't matter. As long as you get the information that you need to do, you pass and you go out there, right? Because as soon as you start talking about what your grades are, other nurses are going to chime in and be like, oh, that bitch dumb. You know what I'm saying? But you ain't got to be. People are judging. That's just what they do. It says no patient will ask about your GPA when you're saving their lives. Facts. What about a BSN program? What about a BSN program? So if you're trying to get into a BSN program, if you're still trying to, work your way up, to get into a BSN program and all that other stuff, of course, keep those grades like that. You know what I'm saying? Appease the people that, that allow you entry, right? But I've seen people get into RN school, BSN school with C's. Don't fucking matter. It doesn't matter. And I'm over here picking my nose and somebody's going to fucking say something about it, but no part of me cares. It says, my instructor said that if you don't get good grades, you are a dumb nurse. That stressed me. Well, first of all, your instructor is a fucking piece of shit. You can tell them I said that and they can come find me on TikTok and I'll tell them that too, because that's not true. However, it is, remember, it's all an intimidation factor while you were in school. They're telling you to get you good grades because they don't want you to fail, right? And I understand that aspect of it. But in reality, just got to pass. But here's the thing is that if you're just going to slump off and you get C's, you're going to be fucking stressed. You're going to be stressed out about C's, less stressed out about A's. Trust and believe me. But think about it like this. A doctor that scored last in his class is still a doctor, right? So I'm just saying. Hearing you say that makes me feel better. I'm glad. Graduating December 8th and I'm in my preceptorship. I need reporting giving tips. Oh, that's just practice. So you gotta when you do reporting, you just gotta give the meat and potatoes. You gotta give the things that are everything that I need to know. Like, hey, I gave them medications, their vital signs. You gotta give them all that. Okay, I hear you. Thank you. You're welcome. I got you. RN since 2012. I refuse to spend more money on a BSN program because what I get paid is long overdue. Facts. I failed, sir, 3 times NCLEX. Is it Ender? Ender, I failed 3 times too. If you want help and you want coaching, you can check that link out in my bio, okay? Longevity, facts. I'm so excited to start nursing school, but I'm super nervous. That's okay. It's okay for you to be nervous because you don't know what to expect. But I would get your time management down right now. Get it down right now. They didn't care about RNs versus BSN during COVID. So here's the thing. And that's one thing I really want to talk. They didn't care about LVNs at all during before COVID. And now they want LVNs everywhere, right? So here's one thing I'll tell you. Don't get confused about the title of RN versus BSN, because an RN means that you have an associate's degree RN versus having a BSN RN. All it is, the associate's is your degree. Your RN is your license, right? And a lot of people get that confused. So I just wanted to give that clarity. How do you contact you? You can send me a DM, or if you need help coaching, I'm literally going to tell you to go check out the website. Okay. We don't have options for C's. It's just A's or B's or F's. Okay. That seems fair. That seems okay. Well, Jackie, fuck it. Get a B then. No, don't do that. That's crazy. C's get degrees. Exactly. Because guess what? Who's going to go up to their surgeon, right? And be like, hey, what did you get in anatomy? And they're going to be like, oh, I got C's. Oh, and this is right before you fall asleep. Well, fuck it. You're asleep now. It don't matter. We are all nurses, bottom line. Facts. We are all nurses, and we should all treat each other with respect. But in reality, it's a job, and you don't get that. You don't get that at all. So, but anyways, y'all, I went over my time by a lot because y'all held me hostage, but it's okay. I appreciate y'all. Here's my little closing terms, is what I always like to say, or my closing argument, like the late, great Jerry Springer. May he rest in peace. Hey, take care of yourself. Be kind to yourself. You only got one you. All right. I don't care about your house, your spouse, your kids, because fuck them kids. I'm just kidding. I love my kids. But that's what I'm going to tell you. Take care of yourself, because if you can't take care of yourself, you can't take care of nobody else. And that's facts. And I mean that. Okay. So take care of yourself. Last shameless plug. The 7-day NCLEX course is $48. That is the price of going to Starbucks for a whole week. Don't go to Starbucks for a whole week. Maybe less than that. Go buy the damn course. All right, go buy it. $48. And you get it forever. I promise you. And you're going to get all the updates. All right. So if you are graduating in the next 3 to 6 months, it is perfect for you, because it's going to give you the reviews that you need. All right. Also, if you're looking for one-on-one coaching where you can sit here and we can talk back and forth on the computer, and we can go over stuff with, whatever you need, I got you. You guys can go check that out. That link is also in my bio, the NCLEX one-on-one tutoring, or the coaching, whatever you guys want to call it. Okay. Caffeine is a sacrifice I'm not willing to make in nursing school. Ma'am, Taylor, I didn't start drinking coffee until I got into nursing school. So trust and believe me, I know. But all I'm saying is a week, Taylor. Don't be selfish. All right. I'm just playing. But yeah. So that's my shameless plug. I appreciate everybody being here. We do these every Monday, Wednesday, and Friday at 5:30 Central Standard Time. That's Texas time, because that's the only time that matters. Sorry for the rest of the world. I'm just letting y'all know. But we'll be back on Friday. Hope everybody has a good rest of their week. Hope everybody gets prepared for the live on Friday. And until then, everybody be safe, and I will see you.